Well, welcome everyone to the fourth annual CADRE conference. The Coalition for Advancing Digital Research and Education is a joint effort between the library and the Office of Research at Oklahoma State University. Our goals are to encourage collaboration and communication among those at OSU engaged in data-intensive research and computing, and to offer students opportunities to gain those data management skills necessary for them to succeed in today's workforce or in their pursuit of a graduate or professional education. This annual conference is intended to share important research, learn about new software and computing tools, and create conversations about the role of academic libraries in advancing digital knowledge. Last year's conference was held virtually as the COVID-19 pandemic was gaining traction. We were fortunate then to hear an address from Dr. Jess Mazurek on the efforts of the National Institutes of Health to create an educated workforce that will implement the data-driven research of the future. The conference theme this year is the changing future of data research, cross-disciplinary problem solving. Not surprisingly, the impact of COVID-19 features in many sessions throughout the conference, including one offered by OSU's own Dr. Jared Taylor, who is currently serving as the state epidemiologist for Oklahoma. We're also proud to host Telling Their Story, 100 years since the Tulsa Race Massacre. Librarians, archivists, scholars, and activists will talk about the importance and the difficulties of recreating an event that had been misrepresented for a century. This misrepresentation illustrates how critical it is that we understand how historical data has been collected and how it has been interpreted. Students at this conference will be well represented this year with presentations in both the lightning round and student showcase sessions and in the technical sessions. The Outstanding Student Presentation Award will be revealed at the conference closing, and the winner will be recognized with a membership to the Evergreen Data Visualization Academy, an opportunity to upgrade their data skills. We want to thank our sponsors, Dell Technologies, OneNet, and Advanced Clustering Technologies. And we at the library also appreciate the ongoing support of the Oklahoma State University Office of Research. I want to thank you for your participation and hope that you enjoy the conference. Thank you.
Thank you, Dee Johnson. And next up, we have the Vice President of Research at Oklahoma State University, Dr. Kenneth Sewell.
Well, welcome everyone. I'm often reminded of an old entry line. I can't even remember who did it, but I believe it was a commencement speech where when I do these introductory remarks and welcoming remarks, the line was, you know, I kind of feel like the corpse at a funeral. You sort of have to have me here, but no one wants to hear me say much. So I'll be very brief in these remarks, but I do want to welcome everyone. And I want to reflect on the origins of CADRE in welcoming you just a bit, because I think that it lets me brag on Oklahoma State University just a little bit, because this is something that happened in this particular case, but it really reflects the spirit of our faculty and staff and students here at OSU. Some years ago, 5-6 years ago, I suggested to my assistant vice president for research cyber infrastructure, long title for my supercomputer guru, Dana Brunson, that she might want to put together a group, a kind of a users group that would advocate for the supercomputing tools that she was in charge of here at OSU. And she came back and said, you know, I'll do you one better. I've got these partnerships with the library that I'd like to really leverage and take this further and be much more than just a supercomputing group and resource. And she pulled Sheila and I together, and that was the origins of CADRE. And they ran their first conference within just months after that initial gathering. And so the spirit of collaboration and the spirit of let's take an idea that might be a so-so idea that came from an administrator, you know, they don't have that many good ideas anyway. And let's turn it into something that's really vital and really will be useful for way more than just the users of supercomputing tools and high performance computing at OSU. So that's the origins of CADRE, and you're a recipient of that. And Dana has moved on to Internet 2, and many of you probably know and work with her in various capacities. Pratul Agarwal is our new director of the center, the High Performance Computing Center, and in that assistant vice president role. But CADRE has taken on a life of its own, and the partnership with the library, this is just one small way that we partner with the library at OSU. Now, back to my role as the introduction, and so I feel like it's important for me to introduce a little levity. So I did a little digital research of my own and tried to come up with some nice little digital research jokes. Unfortunately, I mainly found what I would qualify as corny dad jokes. So let me start by showing one of my corny dad jokes here. So even the gender is corny and dad-like, right? So why did the programmer quit his job? Because he didn't get a raise. Ha ha ha. You have to have a Chuck Norris joke if you're familiar with that genre of jokes. Chuck Norris writes code that optimizes itself. That's an interesting one. But my favorite one, because it gives me a little transition into the last remarks that I'll make, are when the little boy asked his dad, let me blow that up for you a little bit, what are clouds made of? And his dad says, well, Linux servers mostly. Okay, I'll quit. I'll stop sharing and get back to my welcoming remarks. But particularly that last remark about the Linux servers, we're in a different world. And I know you people know more than anyone else how different a world we're in than when many of us with grayer beards got started with our research lives. You know, when I first began using computers in research, they really were nothing more than a slightly more powerful typewriter and calculator. That's what computers did for us. They allowed us to be more efficient and effective in some of our calculations and some of our storage and some of our communication tools. But as you all know, the difference between a scroll and a codex and a book is just sort of incremental. But once we took things to the computer level, we really have given ourselves new capabilities. And so I envision a day when CADRE will almost be irrelevant. And I want to be careful as I say that, because any conference about research is going to be about digital research. Any conference about education is going to be about digital education. And it's not to say that we won't still need our calculators or our calculating brains or our reading eyes and our hands on a book and our hands on individual specimens. But more and more, everything we do in the research world is digital research in one way or another. So I'm excited for this conference. I'm going to sit in on as much as I can. And I'm excited for the work you all bring here to us. I appreciate you gathering. I'm confident that you wouldn't gather in this way just for yet one more Zoom meeting. I'm confident that you gather with this group because you find value in this collaboration and in this coalition. And that thrills me in ways that you'll never know. So welcome, and I look forward to what this conference can bring to all of us.
I will go ahead and introduce our first speaker for our conference. Dr. Jared Taylor has, as you see in the slide in front of you, an awesome number of initials behind his name. He is one of OSU's own, and he is speaking to us today in his role as the state epidemiologist for the state of Oklahoma. Welcome.
Thank you very much. And I certainly appreciate the opportunity to present here, to speak with your group and organization. I hope that I've put together something that's going to have some appeal to this group. I do a lot of these, but they tend to be focused more on like providing an update of the state's current situation in regards to COVID, or, you know, various interventions that we've done. And for this one, of course, I wanted to take a different tact. You guys certainly may have interest in our current state's positioning in regards to COVID or whatnot. If you do, feel free to reach out to me and I'd be glad to talk to you about that. But for a group interested in data sharing and research and you know, kind of the modern age, I took a focus on technology, and technology arguably has been the bane of my existence as the state epidemiologist during this time. I don't think it needs to be. I don't think it should be. We certainly don't want it to be, but it created a great deal of challenges or attempts to utilize technology as we think that we should be able to, have created a number of challenges for us. And so I thought it would hopefully be informative to share those with this group. So what I want to do is sort of compare and contrast the needs for a public health response as the public health infrastructure has been constructed versus what we needed as we had this emergence of a pandemic. And I'm going to frame most of the presentation from the perspective of what Oklahoma has been dealing with, because that's obviously where I have the most intimate connection. But trust me, I'm as a state epidemiologist, I'm a member of the Council of State and Territorial Epidemiologists that involves all U.S. states and territories, and we're not unique in the struggles that we've had. I then want to talk about some of the initial responses that we've had, the adaptations, and then hopefully step back a little bit beyond COVID and look at what the technology can deliver to public health into the future, hopefully, aspirationally, I guess I'll say. So to understand the compare and contrast that I want to do of public health infrastructure as existed in 2019 versus where we are right now, I think it's important to recognize that most health threats in the United States and the developed world as a whole are chronic, non-infectious disease challenges. So obesity, smoking, environmental health, the leading causes of death being heart disease and cancer, diabetes emerging as a leading cause of death, and certainly being a comorbidity and a risk factor for lots of other things, and compromising quality of life. That's not to say that infectious diseases have completely been abandoned from the public health perspective or neglected. We do have numerous infectious diseases that are reportable for public health purposes, tuberculosis being a common one, HIV, human immunodeficiency virus. An array of sexually transmitted infectious agents are reportable. We certainly investigate foodborne disease outbreaks, meningitis, and then we have sort of these hybrid programs, sentinel programs for agents like flu, and flu being probably the most notable in this regard, where we don't try to track every case of flu by any means, but we try to have a pulse on what's taking place in the population. So we've got systems designed for all of these infectious diseases. And yet, as you can see on this slide, that tends to be rather low numbers. The last bullet we have down here for those infectious disease cases, 73 cases of tuberculosis disease in Oklahoma in 2019. Now, there were as many as 22,000 chlamydia infections in Oklahoma, so that's not a small number. But the workup that we tend to do for those chlamydia infections is much more limited than what we would do for tuberculosis, HIV, or certainly COVID. And in HIV, you see 280 diagnoses of HIV in Oklahoma in 2018. So very different scales of what we see in these infectious disease compared to what we see for the non-infectious disease. And these chronic diseases are surveilled at the population level. You don't go to your physician and get diagnosed as being obese, and then you get a phone call from the public health department, right? We don't do that. It's a very different function that takes place. We're really looking at what's happening at the population level. In contrast, because infectious diseases are infectious, contagious, we do want to do an individual case investigation and gather information about that and try to protect the public from that risk. And so we have a whole array of activities that are entailed in that investigation, from inquiring about where they perhaps acquired this infection themselves. That becomes really important because we want to be able to determine if other individuals would have acquired the infection from the same source. We want to follow that individual over the course of their disease. Are they complying with treatment expectations? Are they complying with quarantine isolation demands or expectations, requests? All of those kind of things. We want to be tied in to that individual. And then of course, we hope to document the outcome. And obviously that the needs for those activities vary with each disease. Tuberculosis is transmitted very differently than is HIV. And so that case investigation looks very different. We're going to follow those, for a different period of time. If, syphilis or chlamydia is not going to be followed for the protracted period that you are going to for tuberculosis or HIV. For tuberculosis, we may have directly observed therapy where we literally have a health department employee or representative who must observe the patient taking treatment. And so all of these things are very individualized for the disease and for the person. And because those infectious diseases are not the dominant disease in the United States or the developing world, and the ones that we are concerned about have been at relatively small numbers, we just have not built an infrastructure that could scale up and respond when that occurs. So how did we work for these reportable diseases? Again, HIV, various STIs, tuberculosis, those are what we call reportable diseases. That means that the state is supposed to be notified when a case is diagnosed. We have relied upon passive surveillance. We are not going out knocking door to door and testing people. We may investigate and encourage people to undergo testing as part of a case investigation if we find out that they've been exposed. But the initial process generally starts from this passive process of surveillance, that someone seeks out care, and then it's incumbent upon the care provider, the laboratory, or both to report that information to the state to initiate our investigation process. Oklahoma is not unique, but certainly one of a smaller number of states that utilizes dual reporting. That means that both the physician and the lab are required to report to us. So if you go to a physician and they do a blood draw and they send that off for HIV testing, that can go to any number of for-profit laboratories or even hospital-run laboratories, whatever. And then they send that result back to the physician to communicate it to the patient. Well, that physician is supposed to report it to us, and the lab is supposed to report it to us. The purpose of that is to give you a little bit of a safeguard in case one or the other forgets to report. And then the other thing is they bring different information, right? Hospitals and physicians are going to report clinical information where the labs report diagnostic information. What test was utilized for this individual? Was it under proper quality control processes? Maybe in certain cases, it may be, what is the S to P ratio on that? What, so was it a nasopharyngeal swab or a saliva test? Was it PCR or antigen testing? All of those kind of things. We're only going to get that from the diagnostic lab. So that's why we have this dual reporting. And then once we get that information reported to us, an investigation is done by the county health department. So they have access to the system into which the physician in the lab reports, and then they access that, contact the patient, gather information on all these potential exposures, clinical outcomes, all of those kind of things, and then also communicate information regarding the need for isolation, the need for continued follow-up for medical care, and all of those kind of things. So it's very much not only a two-way street, a multi-way street, right? We've got to have labs and physicians talking to us. We've got to then be able to talk to the patient, get information from the patient, convey information to them. We need to be able to reach out to the physician, all of these kind of things. And that becomes really, really critical now. All that background information becomes really critical as we start moving in and speaking specifically about COVID, because there were so many folks who just wanted to flip a switch and employ technology to accomplish these tasks for what we wanted to do to surveil and follow and mitigate for COVID. Well, case investigation has an enormous array of functions that we kind of already covered in those previous slides, but this lays it out, sort of a summary of what we're going to do. We need to acquire information from whether the patient was symptomatic or not, what test was done, where were they potentially exposed, who have they potentially exposed during their infectious period. We want to know, was that individual hospitalized? Was that individual entered into ICU? Did that individual die? Of course, all of those things we want to know. Then we want to be able to communicate information as well, telling that patient, if you're not hospitalized, if you're not under continual medical supervision, then you need to be isolated so that you're not posing a risk to family members or people outside of your household. We want to be able to reach out to the individuals that they have had contact with and advise them that they should quarantine. And then in some cases, we're actually going to provide care and case management information to the caregivers. That's not so much a case with COVID, but certainly for tuberculosis, as an example, a lot of infectious disease physicians don't deal with tuberculosis. And so we are conveying information to them about appropriate treatment protocols. We're also doing antimicrobial susceptibility for that pathogen and confirming what treatments are going to be best and conveying that to the physician or the care provider. And so again, it's a two-way street. And then finally, we have this thing that everyone was looking for and everyone was looking toward us to provide, of data management, which includes reporting of this information to the CDCs, to state officials, to the public. How many cases were there today? How many deaths were there? How many people are in the hospital? How many people are in the ICU? All of those kind of things. And we need to have that data management for performing the public health activities of trying to intervene and prevent it from spreading. So doing investigation of outbreaks, determining where it originated, determining who is at risk, for being infected asymptomatically, not even knowing that they're infected, but posing a risk to others. Also doing sort of basic epidemiologic research, applied epidemiologic research to determine risk factors, those kind of things. And so again, everybody wanted to look at this last domain, this data management and reporting, and say that technology ought to help you get this stuff out immediately. But the reality is that we can't do that in a vacuum. We needed to be performing these other tasks as well. There were other challenges that you will be very well familiar with as well, in terms of trying to track and triage, and in some cases distribute resources around. So in terms of hospital beds, hospital staffing, personal protective equipment for our healthcare providers, and testing resources, all of those things became something that there was a desire to manage those resources basically in real time. Obviously, you can't move hospital beds, but you can move patients to hospital beds. You can move patients to hospital staffing, or in some cases, you can move hospital staffing from relatively low impact areas to higher impact areas, those kind of things. And then obviously the PPE and the testing, we wanted to know how much we have on hand, how long is it going to last, who do we need to distribute it to, where can we acquire more, all of those kind of things. So there's a lot of challenges there. I'm not going to speak much about those because those are basically outside of the state epidemiologist purview. And so therefore, I've got familiarity with them, but they didn't fall directly under my domain and supervision. And we've got enough content to talk about. In the absence of that, I believe that we don't have to delve into that as well. But if you have questions, I'll be happy to try to answer those. So now that we've laid out what we have to do in terms of case investigation and case management, hopefully it's clear that no case management systems were designed to deal with an epidemic. That's assuredly true for Oklahoma, but that was true not only across the country of the United States, but really across the world. They've all been designed for these endemic diseases, predictable numbers, known amounts, and that's what we've been able, to sustain. So specifically in Oklahoma, our system, which is called FIDO, is about 20 years old. It was developed using funds and resources that were made available to the public health realm back when we had the last public health crisis. Most of you will probably have some vague familiarity with all of the focus that came into public health coming out of 2001, not only the terrorist attacks, but the anthrax scare. There was foot and mouth disease in the UK during that time. BSE was an animal disease, a zoonotic disease. And so there was just this real concern back in the early 2000s of, do we have the infrastructure to be able to deal with the next big thing that's coming? And so they gave us money. We developed this system, and we've continued to use it because the money really largely dried up. Overall, policymakers and the public lost focus on public health, lost focus on the demands and the needs. And so we were making do with a system that was 2 decades old. Again, designed for an endemic disease situation where you have a very predictable number of cases. It provides some great resources and functionality for those endemic diseases, but it's very dependent upon manual entry of data. A nurse has to sit down and type in a patient's name. A county health department has to go in and type in, we called this person at this time, and there was no answer. And so it's, again, clearly not amenable to scaling up to hundreds or even thousands of cases per day. It's also became unstable at high case loads. And so the system kept crashing. From a true technology vantage point, it was just unstable, and it crashed reoccurringly while people were entering data, while our surveillance team was trying to extract data. And it very much was detrimental to functionality for all of those purposes that we want to achieve through our data management system. So how do we rebuild that? How do we improve that or replace that? Well, again, we've got to figure out how we do all of those tasks that we had laid out before. And the first of those is acquiring data, acquiring information, be that from a physician or from a laboratory. And so I've already mentioned that we have this manual entry process, which we were actually pretty reliant upon historically, because it worked and it met the needs. But other legal ways for labs or physicians to report these diagnostic results, to notify us through this passive surveillance approach, were what's called an HL7 file. That's a standardized file format that's kind of universal for communicating health data and health information. It's HIPAA compliant, which is very, very critical. And you can do that electronically. And if you have an HL7 compatible message, Oklahoma is going to be able to read it. Texas is going to be able to read it. Kansas, any state is going to be able to access that and utilize that information. So that's the preferred approach. That's the technological solution. Unfortunately, it is a technology. It's not the sort of thing that your physician is going to open up that HL7 message and extract data. It really is a laboratory communication tool or a diagnostic reporting communication tool. And so we had a lot of partners across the country who had not moved to utilizing that technology. So other options for them were what are called flat files, which was most commonly an Excel file saved as a comma separated value format. They had to get that to us in a manner that was HIPAA compliant. They can't just email it to us. They can't just put it in a Dropbox. They had to have a HIPAA compliant portal to deliver that to us. We had a method to do that through Fido, but remember, Fido become unstable at those high levels of data entry and data extraction that we were dealing with. And then the final legal method of conveying this information is good old fax machines. That is literally the only other way to get this information to us. Again, you can't email it. You can call and provide some of that information. We didn't want that happening at all. And so we were receiving hundreds of pages of faxes every day conveying COVID diagnostic test results. What do you do with that? Right? Somebody has to turn around and enter that into our system in order to make that manageable. But from a legal vantage point, we had, that is legal, it is HIPAA compliant, and we had provided that as an option for our lab reporters for quite some period of time. So how did states deal with this need to bring in all of these different testing results through different file formats, to reach out to the cases, to reach out to the physicians, all of those kind of things? Well, again, we had Fido. Some states had about 20, over 20 states utilize a CDC developed system called NBS or NEDS, is a different acronym for the same system. So some states, again, 20 some states already used NBS, but they found NBS didn't work for COVID because it was not very much unlike Fido in terms of what it was designed for and what it could do. And so some states left NBS for COVID only. They're still in NBS for HIV, for STIs, for tuberculosis, E. coli, those kind of things, but they went somewhere else for COVID. Some states who had their own homegrown systems, like we did for Fido, chose to go to NBS for COVID because their homegrown system had the same amount of problems or worse than we had with Fido. And so they were going to a system that other people were leaving. Many adopted a system called Sarah Alert, which is compatible with NBS, but was intended to be a little bit more scalable, but it really was only a little bit. And in many, including Oklahoma, looked to novel companies and platforms to try to address these novel problems. So what did we do? We've continued to function in Fido while pursuing these innovative solutions. And so you'll see the font here and continue in Fido is big while pursuing innovative solutions. So what did it mean to continue in Fido? What did we have to do to even begin to focus or begin to function in Fido? We had to end to dual reporting. That was just overwhelming. There's a reason for it. We want to be able to do that in normal times, but when you had both labs and healthcare providers trying to enter data on hundreds of thousands of patients a day, you were getting duplicate reportings with different spellings. You were getting people coming in and overriding existing files. You were getting all sorts of issues there. So we ended dual reporting for COVID. We also ended any kind of transmission or into Fido of negative test results. That's unfortunate. There's value in those negative test results. We want to know those, but Fido couldn't handle them. So we were only entering positive test results. And the other thing about it, not only could Fido not handle the negatives, we couldn't handle it because remember those faxes? We had OSDH employees manually typing data out of faxes into Fido. And you just couldn't do that for all of the negatives. I mean, it was unbelievable that we were doing it for all the positives. You sure couldn't do it for all the negatives as well. And we did eventually phase out of fax reporting and just told our partners, look, we understand that you don't have the ability to do an HL7. We understand that faxing is what you've done for decades. It's got to stop because we can't deal with it. We still ended up getting the CSV files, and then manually entered those. I spent many an evening myself as a state epidemiologist copying and pasting data out of CSV files into a different template, forcing it through a process that generates an HL7 file. I mean, that's where we were at. I was doing it. The director of the acute diseases service was doing it. The subdirector of the surveillance group was doing it, because that's the only way we could continue to function. So that's how we were trying to continue in FIDO. What were we doing in terms of pursuing innovative solutions? Well, we opened a call center for contact tracing, and we entered into a contract with Express Personnel, which is a temporary staffing agency, and they were able to provide us personnel to work with supervision to be reaching out and contacting our cases, and most importantly, our contacts, people who had been contact to a case, and advising them that they needed to quarantine. We also moved to an MTX platform for contact tracing, for them to be entering that information into MTX, because to help with that FIDO loss of stability. We moved to another company called Spring ML for diagnostic reporting, for getting labs reporting, hopefully HL7s. We wanted to move only to HL7 reporting as our method for COVID diagnostics, and Spring ML was our partner for making that happen. And then we entered into a separate contract, with MTX, the same company, but a different platform to do our case investigation as opposed to our contact tracing. And that was a mistake to enter into a contract with the same company, but on a different contract to build a different platform. And we're still trying to rectify that even now. So the pitfalls in those partnerships that we encountered, one is that temporary employees are not public health experts. And so we had these Express personnel who were doing yeoman's work at their tasks that was assigned to them. But we learned very quickly that you could have no flexibility and no nuance in that system. Those individuals had to convey a single message, and they had to do it over and over and over. Well, if you're going to do that, you don't need a person doing that. Let's figure out how to automate that, have a voice call, a robocall basically, or a text message or something like that. We also found that MTX and Spring ML were technology companies. They were not health companies. And that created some problems as well. So the initial results that really we got is we got fairly rigid systems that met the specs that we had delivered to MTX and Spring ML. But look, we're public health experts. We're not tech people, right? And so we were going to these tech companies and trying to lay out the specifications, and we didn't know what all those needed to be. And the tech companies were hearing our specifications and building a system that met that, but then they didn't deliver the needs that we had because we were talking a different language than they were. And again, we're still trying to rectify that and move out of that, the consequences of that. We also found that there were reluctance among partners to adopt these new approaches. Again, you had reporting partners, sometimes labs, true labs that, that have PCR technology, that have sequencing technology, but by golly, faxing was a whole lot easier for them than creating an HL7 message. And so they didn't want to create an HL7 message. They wanted to keep faxing results. And, we do consider them partners. That's the phrasing, it's here. That's a phrasing you'll hear me use over and over and over anytime I talk about these folks. So we didn't want to go in with a hammer and tell them they needed to do something different. But at some point, we also needed to be able to exert some type of power or influence over it and say, that's what we need to have happen. The major lesson that we learned is that the weakest link prevails. All of these processes are interconnected. And if one of them fails, then you don't get the outcome that you want. And what was most apparent to the people of Oklahoma when we got into October, but particularly November, December, and January, everybody in the state of Oklahoma knew someone who had had COVID, right? Or at the very least, if they didn't know someone who had had COVID, they knew someone who knew someone who had COVID. And everybody knew that if you had been around somebody who had COVID, you should be under quarantine. Well, how did you know to go under quarantine? Well, you had to be contacted by the Oklahoma State Department of Health and told that you were a contact to an infectious individual and that you should quarantine. Well, to get to that point of communicating that information to those contacts, we had to be notified that the person had tested positive. We had to do a case investigation of that person to find out who they had been in contact with. And then we had to reach out to those contacts and communicate that very vital, needed information to them. Well, everybody in the state of Oklahoma could look around and say, you guys aren't doing your job. We know you're not doing the contact tracing that you're supposed to do. And so you're failing. And, you know, the truth was, we had these people sitting in the call center, not exactly twiddling their thumbs, but they weren't overwhelmed. It wasn't that they couldn't get through all the contacting in a given day. We couldn't get the information to them quickly enough to allow them to do that at the level that they needed to. And so that weakest link prevailing is really, really critical as we look at moving forward. You know, how do we rectify these issues that we currently are dealing with, and how do we avoid it moving forward? The specific failures that we have seen that were apparent to the public, you know, like specific events, are those contact tracing and case investigation inadequacies that I just described. And we were roundly criticized. In fact, there's been a legislative oversight and fiscal transparency. It's called LOFT, Legislative Oversight and Fiscal Transparency inquiry into our case investigation and contact tracing efforts. And we were roundly criticized in that regard as well. It was an easy target to say that we didn't do it adequately. But really that, again, was driven in no small part by that second bullet, our inability to get labs into HL7 reporting. If they did a test, if a sample was collected on Thursday and shipped to the lab and they received it on Friday, they might not run that test until Monday. And they get the result on Monday, but then they wait until the end of the day and they send us a fax on Monday evening. And our people receive it and basically start trying to work on it on a Tuesday morning. Well, they've got other things that they got to do as well. And so it might be Wednesday afternoon, Wednesday evening before they get that entered. Well, we're a week behind when that person went to the physician now, right? That person went to the physician on Thursday and had that sampling done. HL7 wouldn't have fixed all of that, but it sure would have cut it back down to going from a Thursday to a Monday is basically what it would have produced. So we had this delay in case reporting. We also got this dumping of old cases where, and this still happens. I mean, I was on a phone call yesterday where I was told a large lab, again, what should be a very modern functional lab, haven't gotten into HL7 reporting, and they found that they were putting their CSV files sometimes in a wrong place. They just misplaced them. And then they stumble upon them weeks later and go, oh, I guess we had to tell OSDH about that. Literally weeks later. Well, we still need to count those. You know, CDC and others want to know how many cases have there been in the state, but there's no way to do a case investigation on that at this point. And then we had the loss of percent positivity information as well. That's a phrasing, percent positivity, you've probably been exposed to in the popular press. It's become less critical here recently with the drop off in cases that we've seen in Oklahoma in particular. But in order to calculate percent positivity, you have to know how many people were tested that tested negative. Okay, you see, you don't just have to have your positive information, you have to have your negative information. Well, again, we weren't entering that into FIDO, And so we couldn't do that. And that was really critical information that I wanted to be using to inform counties of the risk, to inform school systems of the risk, to inform state leaders of the risk. And we lost that. We also ended up with a lot of duplication of case reporting because we had had this dual reporting system to begin with. But not only that, we had the situation where a county health department would start a case investigation, and they would call Jared Taylor and they would say, Jared, we understand that you tested positive. And I say, yes. And they say, who have you been in contact with? And I say, well, of course, I've been in contact with my wife, Wendy Taylor. She lives in this household. And they would say, well, has she been tested? And I might say, yes, she has. She tested positive. Okay, she's a case. So now the county health department manually enters in Wendy Taylor is a case, but the lab hasn't reported that result yet. And so the lab eventually faxes in the result that Wendy Taylor's positive, and some other poor person starts generating that report and then finds, oh, Wendy Taylor's already in here. Well, is all the data the same? Did that get entered correctly? So, I mean, it was just horrible what was having to be done. And then because we were trying to do that, we ended up not being able to keep up with that. And so we had one day where we had a large number of cases that were reported. And I got an urgent call from leadership saying, wait a second, are these all new cases? Are they real? Are there any duplications in that number? And I told him, yes, there are duplications there. Just like I've kind of told you over the last 10 days to 2 weeks that there are duplicates there, because our people were time constrained of how much deduplication they could do and how much they could extract that information and eliminate it. And so we had a period of time where we were reporting more cases than we actually had in the state, because again, that county health department may have entered the data once, and then the lab, maybe they actually did, maybe that lab did submit an HL7, and so then that goes into FIDO automatically. So Wendy Taylor could have ended up in FIDO twice because she got submitted as an HL7 as well as manually entered before the HL7 showed up. So luckily, we were able to fix that deduplication issue by moving to a one-day lag in reporting of case numbers. It was phenomenal to me how much flack we caught about pulling off one day. But real-time data is not meaningful anyway. I've tried to convey that so much. You should not make any policy changes based upon today's numbers versus yesterday's versus Monday's. But people developed this appetite to know in near real time, and that brought its own problems. And then finally, most recently, again, anyone who follows the Oklahoma saga will know that we had a discrepancy between the National Center for Health Statistics at CDC and our acute disease services death tallies. Now, the reality is that wasn't a failure. That's just the way the system works. The National Center for Health Statistics, NCHS, they get their data off of death certificates. Our ADS death tally comes from this case management system that I've been describing to you all along. They're two different systems. Of course, they've got different inputs. Of course, they're going to have some differences in values. But unfortunately, as we got farther and farther behind with more and more overwhelming us in November, December, and January, that difference got exceedingly large. We ended up going to the point and saying we feel like the NCHS number, at least right now, is more representative of what's actually happening in the state. And that was sort of seen as a failure or a black eye on our part in terms of case management and case investigation. Now, the reality was this was a result of incomplete case management entry that had nothing to do with us. This is another the weakest link prevails lesson. Basically, for us to know a patient died, if the way the system ideally works is that person goes and gets tested and they test positive and it gets submitted as an HL7 and boom, we know they're a case. And then the county health department reaches out to them and contacts them and says, do you have symptoms? And they say, yes, I do. I'm febrile, I'm feeling quite ill. The county health department enters that in. That person then goes to a hospital. The hospital enters into our FIDO system as well and says John Doe is now hospitalized at St. Anthony's. All right. And then they update us that that person has now been moved to the ICU. And then ideally St. Anthony's or whomever, right, updates it and says John Doe passed away. Well, if they did all that information, we know that the next day, but they were overwhelmed. The hospitals, the county health departments, the nursing homes and long-term care facilities, all of these places that are supposed to be entering that information into FIDO, they were overwhelmed. They basically stopped updating those records. We're dependent upon them providing that information. How are we supposed to know that John Doe died if the hospital doesn't tell us? So we got crucified for that, for not having completed those investigations. But the only way we could know about it was by going through the death certificates. Well, why aren't you going through the death certificates? Well, because our folks were entering fax information into FIDO. That's why we weren't going through death certificates. We were overwhelmed. So what did we do in terms of stopgap measures to try to deal with this? Well, we went to an unverified voluntary aggregate reporting system for hospital beds, for ICU, and for testing. So basically what that says is if OSU Diagnostic Lab sends an HL7 to our system, we're going to know all the individuals that they're telling us about, positive and negative. But if they send us a fax, we wouldn't until we get that entered. And so what we had them do to keep it real time is we said, no matter what you do, whether you send us a fax, whether you send us a flat file, whether you send us an HL7, you also go to a Qualtrics survey and you just type in, we ran 100 tests today, of which 6 were positive, but we have no way of verifying that. Verifying the veracity of the data that they're entering, verifying that they're actually doing it. It is voluntary, and we can't verify that each of those individuals are individuals. So that person may have been bouncing around and getting tested at 2 or 3 different places because they were sure that they were infected and they kept being told they were negative, or maybe they were sure they weren't infected and they were told they were positive. So, but that was the best we could do. And that at least allowed us to do some degree of percent positivity calculation and know how much testing we were doing in the state. We were also, as I've said, ad nauseum at this point, relying on this manual entry and very long hours of personnel typing in, reviewing, deduplicating all of these tasks that are, really outside of the expertise that these individuals should have. And so that was very excruciating for them, but it also came at the sacrifice of other disease control efforts. We've got some notable STI outbreaks taking place in the southeastern part of the state. That would be on the news on a regular basis in normal times. In the midst of a pandemic, I'm guessing many Oklahomans have not heard that that's the case. And so we had this compromise of actual public health interventions in efforts to respond to that. So fortunately, we have made progress. We have overcome some of these issues, but we continue to experience challenges, particularly in terms of integrating all of our data systems. I said that it was a mistake to enter into contracts with MTX to do both case reporting or case management and contact tracing. We've got one company that's built us 2 systems that don't talk to each other very well. And so we're trying to rectify that. We still struggle some with data reporting. We've moved to 1 time a week reporting now. That gives us a much better chance to have better quality control and to also be doing these other tasks that we need to be accomplishing. But again, we got a lot of pushback for moving to that once a week reporting process. And then of course we have new demands and evolutions in the process emerging all the time. We have to build a system that says, oh, well, if you were exposed, you're supposed to be quarantined, right? Oh, well, no, you were previously infected. So we're going to assume that you're going to have immunity for at least 90 days. So that's a new added wrinkle to the system of what we're communicating, whether that's from a call center, whether that's from a text message, or a robocall or whatever, that's a new wrinkle. Have you been vaccinated? Another new wrinkle. Now you're not going to have to quarantine if you've been exposed and you're asymptomatic. What about sequencing and figuring out whether you have a variant? Is that going to alter our case investigation? Are we going to ask different questions, go more into depth, make different recommendations for length of quarantine or isolation, or those kind of things? Schools now doing testing. We love our schools. They've been fabulous partners, and we appreciate them assisting, but they're not labs, right? How are they supposed to know how to do laboratory reporting? That's been a huge challenge. And now the next thing coming around the corner is at-home testing. And this is a reportable disease. We want to know everyone who's positive, but if you buy a kit off of Amazon and you do it in your bathroom, are you going to feel compelled to reach out to OSDH and tell us that you tested positive? That's going to be a hard sell. So the final thing that I want to talk about is sort of the using and abusing technological solutions that we've seen and that I foresee in the future. So as I said, everybody wanted to jump into this idea of saying, well, let's leverage technology to do these simple things. And so there's a lot, you've probably seen them yourselves. Maybe you've got them on your smartphone, of various exposure and contact tracing apps. Those are fine. I'm not going to discourage you from using them, from downloading them. We've had any number of vendors try to partner with us. We do have some partners with Apple and Google. I do have a partnership with Apple and Google for these apps, but it's really critical that you understand what they do and what they don't do. They do not communicate data to the OSDH of who tested positive, who has symptoms, you know, are they hospitalized, those kind of things. We still have to be getting that information, and you've got to integrate all of that. And if that app is a standalone app, good luck figuring out how to make it communicate with a system that's bringing in an HL7 message and make those two work together. Same kind of thing with testing notifications. So I mentioned the at-home testing. A lot of those come with an app that you don't even get a positive or negative off the test, but you scan a QR code and you get a notification through that app of your test result. That's one method that they're hoping to allow reporting of those results to the state, but that has to be compatible with whatever reporting system you have. Is it going to generate a true HL7, or are they just going to want to send us some type of data dump of what's happening, and we have to figure out how to make that happen? And then even the reporting applications for labs and those kind of things, all of it is or reporting results out of trying to reach out from a lab. We've got a large lab in the state right now that's using an app that to notify persons of what the results are, and they get frustrated because OSDH then sends out a text message saying that this person tested negative or positive, and the lab is going, well, we've already notified them, and people are getting confused that they're getting the same message from different sources and that sort of thing. Well, we can't rely on that to do our job, right? We have to be doing our job of communicating with individuals and telling them if they're positive, they need to go into quarantine and those kind of things. So there is the opportunity to leverage technology, and I do believe that there are successes to be had, but you know, we've got to figure out how to integrate all of those, which would be the last thing that I'll talk about. The abuse of technology. So I said the use and abuse of technology. The real abuse of technology has been this idea of instant gratification, this demand for real-time data. And the data that you see on, the closer you are to real-time, the less reliable that data is, period. And I'm guessing everybody in this audience and in this call recognizes that, but it's hard to convey that to the public, right? They're going to be asking, what do you mean it's not reliable? You know, are you cooking the books then? It ought to just come in, and you ought to be able to post it on a public facing website right away. There is a lot that has to take place to convert that to information. And so you really do still have that paradigm of garbage in, garbage out. We can push this data out and make it available. You would be, you know, you want to see somebody get upset, you post data that says, you know, 483 people have died in Texas County, Oklahoma. And then tomorrow you reduce that to 482. And somebody goes, what happened? Did you bring them back from the dead? How do you miscount a death? Well, that person lived in a different county, lived in Texas County, or I forget which county I referenced there, but they lived in a different county, and we had to QA it, and we found that they died in this county, but they died in Cimarron, but they lived in Texas, or vice versa. So we changed it. That's normal. That's okay. But people really flip out about that, like we're trying to manipulate something. So what I've learned, the public health functions are very different from individual or informational desires. We need physicians to be able to communicate with their patients. We need patients to be able to get meaningful information from their care providers or whatever, but that is different from what we need from a public health function. And we need to be able to make sure that those hopefully tell the same story, right? Even though they're serving different purposes and maybe coming from different directions. I certainly have learned it's really difficult to build that infrastructure while it's being used. I mean, and everybody's heard that analogy of building the plane while you're flying it. You know, we're still doing that to this day, still trying to use these reporting systems while refining them and improving them. And that's really, really difficult. Another lesson, decentralized systems, including the federalist system that we have in the United States as a whole, they have advantages and disadvantages. Again, you know, there was a lot of innovation taking place. Different states were trying different things, but you get labs that are really frustrated because they may be reporting results to 6 different states, and those 6 different states have 3 different ways that they want those results reported. And that gets very frustrating for our lab reporting partners, and for all of this coordination. And then the same takes place from us out to the county health departments and those kind of things. And so, you know, flexibility, and I mean this not only in terms of adaptability, but also in terms of saying, well, look, we can't get data out today. That doesn't indicate that we're doing anything wrong. It doesn't indicate weakness. Allow that flexibility. Allow us to change that deaths count from 483 to 482. But boy, folks don't really like that idea. So where do I think we can go in the future? How can we truly leverage technology, I guess, is what this is. I mean, I'm not, my crystal ball has been broken for a really long time, and it's failed me a lot in this pandemic. So I'm not trying to project where I think we're going to go into the future. What I'm saying here is, what do we need to have happen for technology to truly deliver on the promises that we think it can deliver in the future? One is to reduce this fragmentation. And that's real challenging because, again, you have this idea of innovation. Well, what if Apple wants to develop an app? And guess what? Apple and Google, they don't play real well together very often. And so they're going to have different systems. And the labs, you know, are going to do different things. They're buying into Healthy Together as a reporting app. Well, as long as Healthy Together generates an HL7, that's fine. We don't care where the HL7 comes from. But if they don't want to generate an HL7, then that becomes a stumbling block as well. So the fragmentation is going to exist. What we need to do is figure out a way to minimize its impact and really find some sort of coalescing pipeline that allows that disparate information to come together and to be real and to be reliable. Delivering meaningful functionality to all parties becomes really critical. And that includes that the labs have a portal that's going to work for them to report to us, but that they also are doing what they need to get to us. So it can't be that, oh, whoops, we put this CSV file in the wrong folder and nobody stumbled across it again. But it also becomes a matter of, how do we report to the CDC? And the CDC is reporting numbers out to the public about Oklahoma. Again, it's sort of the result of, or aligns with this idea of reducing the fragmentation, but it is imperative that we recognize how many different stakeholders there are and that all of them have a right to functionality on their end. And then the same thing with the retaining accessibility for all parties. That's been a huge thing that, again, technology's been the solution for scheduling and planning vaccination efforts, right? Well, we all know that, 82-year-old retirees living on fixed income tend to not be great technology wizards. And so how do we retain that accessibility for them to get into vaccine scheduling, to get their test results, to get the information they need to have? What about homeless individuals who have those limitations? Whatever disadvantaged people, we can't rely on technology as being the fix if you continue to have disparities among our stakeholders in terms of their accessibility to it. So that's all that I've got. We've got a few minutes, maybe a couple of minutes for questions. I've seen a couple of, at least couple comments come up on the chat. HIPAA compliant in terms of the faxing. Yeah, that's exactly, that's a weird thing that I've really struggled with. We have the same experience, and ultimately, yeah, it's a hard copy that, has the potential to float around and be seen by whomever, and you're supposed to shred it. You're supposed to have all those controls, but it is what it is, and we've had to deal with that. Yes, I also appreciate the point that I was appointed epidemiologist in August of 2020, and I'm still here at OSU. I've welcomed the opportunity to work with OSDH. I found it very rewarding, but there was no way in the world I was going to leave a tenured academic position to think that this was going to be my future career. So I'm very happy to remain at OSU. Other questions or thoughts?
Okay, folks, if you would like to add questions to the Q&A, okay, we've got one.
Where was the federal government in this mess, the CDC? So they've been in a tough spot as well. Ultimately, again, they can only provide so much guidance, right? We had a CDC team come in and advise us on technology solutions, but they knew that there were 49 other approaches being used across the country. And so, they were basically there in an advisory role, but certainly not telling us where to go or how to fix these issues. And at some point, when you got 49 different methods, they can't fix it. At what point do a lab lose their partnership because they fail to enter? That's been a real tough thing. And that's been, I said, we talk about them as being partners. We've really tried to be reluctant to pull out the hammer. I've got some supervisors who've wanted to pull out the hammer many times, and I've discouraged that. But we are to the point now where, particularly if there's any sort of malice with that lab that they know they're supposed to be reporting, but they're not, or they are, preferentially using a technology that they favor versus what we need them to do, we are going to have some sort of punitive action on them. We can hit them in terms of their CLIA certification. So we do have a little bit of authority there, but at the same time, we do view them as partnerships. So it's a fine line. Great question.
Okay, do you see Pratul's question there about, says, like many research domains, data deluge occurs unplanned and due to expectation situations. Looking back, what major learned and what are the key technology needs moving forward?
Well, so to me, the major need is continual investment. I think that's the struggle. Is we've gone to the legislators, we've gone to the governor. Everybody wants to throw money at us right now, right? The federal government has thrown a lot of money to the states and to everybody, and they want to throw money at this right now, but we can't fix this while we're operating it. So what needs to happen, I said, we've lived this experience, right? We had all that money thrown at us at the early 2000s, and then it went away. We can't go to that paradigm again. This needs to be perpetual investment, continual investment. And we're still going to stub our toe. I mean, you can't anticipate everything that's going to happen, but if we have the ability to invest and sustain these systems and innovate moving forward, then I think we would be better positioned. Now, the reality is public health, we always have to be looking at the most bang for a buck. We're always going to be resource limited. We know that, we expect that. In some ways we thrive under that. But we do have a need for long-term support. I'm thrilled. I'll put in a plug right here. I think we're probably done, but OPCIE, the Oklahoma Pandemic Center for Innovation and Excellence, I think that is an illustration of the future opportunities that we have. I'm hopeful that that entity that largely right now exists only as a concept, I'm hopeful that it continues to be endorsed and supported and has the potential to grow. And if that and similar models are adopted moving forward, I think we'll be much better positioned for whatever comes. Because I've told folks, in preparing for the next COVID, don't plan for COVID, because the next COVID is going to be different. And if we build, it's just like the moniker of the military. If you build the military for the previous war, you're not going to be ready for the next war. So we've got to know that the next public health crisis is going to look different than this. And so we need to have some flexibility in what that response looks like. With that, I really appreciate this opportunity. I've enjoyed it. I think that I welcome the questions. Feel free to reach out to me. I try to be really accessible. So Kay can put you in contact with me if you don't have my email otherwise, and I'll do all I can to help you.
Yeah, feel free to drop any follow-up questions you'd like into our Slack or email me, and I will make sure that we put you in contact.
Thank you for having me. I'm honored to be here. This is a conference about digital research and education. And the opening session talked a lot about the importance of data and cross-disciplinary work. And what I'd like to do is take a step back and think broadly about the context and systems in our environments and what promotes the best possible work in what we call cultures of excellence. So at our center, the National Center for Professional and Research Ethics at the University of Illinois, our mission is to develop values-driven and effective leaders and to support institutional integrity through intentional professional development. And we do a lot of leadership development, and we create tools, programs, and resources to help universities and others educate about ethics, the responsible conduct of research, and most particularly to develop values-driven leaders. Our team is an interdisciplinary one. We work across a wide range of STEM and social science disciplines. And our focus is on the relentlessly practical, rooted in evidence-based research. So before I dive into some of the particular things I'd like to talk about, I'd really like to ask each of you to reflect just for a moment on why we do what we do and why we talk about it. So if I ask you to think about the integrity of science or the integrity of research, what are the core values for you that underpin that? And if you would just make a few notes for yourself, maybe if we can, you could put a few in the chat. What are the core values that for you are about this endeavor of doing research? Digital age, non-digital age, why do we do this and what are the values upon which it rests? Does anybody have anything they'd like to raise here? I cannot actually see anything except chat, so.
I see fact versus belief.
Fact versus belief, absolutely. Anything else? This is the point at which I always tell work groups that I've raised small children, so I have a very high tolerance for silence. Tell the truth, openness and transparency, open communication, building a better future. There you go, a more peaceful and cooperative future. These are some really important issues about truth, openness, transparency. I served on the National Academy of Sciences panel on fostering integrity of research, and we started our work by thinking about what are these core values and why do we care about them? And we came up with 6. Objectivity, which is related to what's real, being balanced about it. Openness, I think we got openness in the chat. Accountability. A great deal of public trust is invested in us and what we do, and the funds that we receive to do our research, and the organizations and the institutions and the contexts in which we do them, in the education of the next generations with which we're entrusted. So we're accountable for that trust in those investments. Honesty. You can't do this if you're not honest about what we're doing. Fairness, and a sense of stewardship. Again, particularly when you are responsible for creating and disseminating knowledge and for educating the next generations, our stewardship of how we do this is really important. And these values matter to us because we want the work we do to be rigorous. We want it to be robust. We want it to be reproducible, which is particularly important as we move into the digital age and people work with code and making sure that people's code is, you can get access to it and run it. And all of these things matter because we know you want it to be like real. What happens in our environments to be real that others can build upon, and that helps us build that more peaceful and cooperative society based on real solid information that others can build upon. And one of the things that we believe is that people and structures interact in an institution to create and maintain a culture of excellence. Well, what do you mean by that, you might say, in a culture of excellence? And for us, a culture of excellence, our premise is that excellence is more than just what is done. It also encompasses how the work is done. And so for us, that's with rigor, with reproducibility, with meaningful inclusion, and with integrity. And why do we include inclusion? Why is that a part of our core belief statement? Well, for one thing, it's the right thing to do because of the society in which we live, if you're thinking about a more peaceful and cooperative society. And the other thing is that we know is that diversity in working groups leads to greater productivity and creativity, especially for new, complicated, or difficult problems. We are in an era now where a lot of the problems that individuals working alone have already solved. We're in an era now where it takes collaboration, working across disciplines, access to big data. So it takes interacting with others, particularly others who see it differently, who bring different backgrounds, who bring different perspectives, who bring up an insight to it that we might not have. So as we think about working with others in our environments, we have to think a little bit about the kind of environments we create and sustain. Because we know from a lot of research, particularly in the social sciences, that people are influenced by the choices of those around them. If you work with people for a long time, you will become more like those people over time. They will influence you and you will influence them. One of the particular elements of the research that's relevant to research integrity is in the work of Dan Ariely and his colleagues, which is that we know that the amount of cheating in which human beings are willing to engage depends on the structure of our daily environment and the choices of those around us. One of my favorite papers out of the management literature is a classic written in 1995 by a man named Stephen Kerr, and it has one of my favorite titles of all time. It's called On the Folly of Rewarding A While Hoping for B. And he talks about reward systems that are fouled up in that the types of behavior rewarded are those which the rewarder is trying to discourage, while the behavior desired is not being rewarded at all. And if you think about it, in the business environment, we talk about long-term profits, and yet we reward people on quarterly profits. In sports, we say we care about the team effort, and who do we lionize? The individual high scorer. And so all these things are thinking about what do we reward and what do we really want to get? In our environments, in research environments, we send a lot of mixed messages about counting papers and H factors that reward irresponsibility. We accord very low priority and status and funding to doing education about the responsible conduct of research. And what we do is often compliance and poorly timed and ineffective. And we don't always attend to the culture And we have been in an environment where the competition has intensified so greatly in most recent decades that we operate, and our early career researchers in particular, operate in an environment of hyper competition. In too many of our environments, these mixed messages about results over rigor and uneven mentoring and abuses of power, irresponsibility, and retaliation, lack of resources for problem solving. Too many of our environments feature too many of those features. And one of the things that I think it's important is, I'm trying to step back and ask you to think about these things, is that we have been talking about some elements affecting the rigor and integrity of research for a very long time. And we're still talking about the same things. The dialogue about what we're talking about has not changed much in a very long time. So for example, Paul Friedman, who is a radiologist at UCSD, talked about problems to overcome: negative faculty attitudes towards compliance with regulations, entrenched reward systems, whistleblower stigma. And he talked about opportunities for leadership, rewarding fine work for quality over quantity, limiting lab size so trainees can be adequately mentored, integrity and judgment of administration setting the tone. And he said all of that in 1988. And yet, while those problems are the same, our research is being transformed by technology changes, by the increasing globalization, by the increasing cross-disciplinary work, by the growing competition, and in many cases by the increased policy relevance of the work that we do. Now, people are talking more about the systemic flaws that we are seeing these days, which means that we are now bringing the conversation back to environments, which underscores our main point, which says people and structures interact in an institution to create and maintain cultures of excellence. One of the things that it's important to think about is that research groups reproduce themselves, propagating their current culture. And the challenges for students start early. Students start in a group, they learn how things are done, and they develop a mental model of research. They're likely dependent on the advisor for funding and reluctant to change even when their sensibilities or other experience, whether it's their responsible conduct of research or their education or their own values they bring with them, suggest a practice is inappropriate. I spend a lot of time talking with people in which I say, just because a practice looks like it's winning doesn't make it right or ethical. And at the end of the day, we are each responsible for our own conduct, and we're responsible for how we affect the systems around us and what we look at and what we talk about that. And we see that as citizens in the world around us today. Where do we stand up and be counted? So cultures of excellence in our institution feature ethical professional conduct, require attention to everyday behavior and interactions, and formal learning about the responsible conduct of research. And one of the things that I would say is that the approach that we take of this one-size-fits-all multiple choice compliance training is not RCR. It is not education and the responsible conduct of research. And I don't know about you, I have just finished in the last few weeks my annual training for, 3 or 4 different things. And it's online training, and I get penalized if I go too fast. So I'm encouraged to open a page, get a cup of coffee, go back, answer it. Even if I know the answer, I can't go through it too quickly. I have a daughter who started a new job not too long ago at a university, and she's now on her 5th day of going through online training, including for handling lab animals, which her work does not require. But she's right up on what the current regulations are. So one of the things to think about is if this kind of compliance training, this online multiple choice, and there's good reasons that institutions do it. It's scalable, it's documentable, you can prove that you've done it. Unfortunately, if you look at some of the research and some of the studies that have been done, all too often, even that isn't really reliably done. So when I think about that's not sufficient, what do we need and how do we think about these issues? Well, if you think about environments and how we work together, and you think about what goes wrong, In my worldview, so much of what goes wrong around us is about power and how we treat those around us. And things go right when you have skills to respond if you see something going on or that it affects you. So the real world skills that I think we all need and our students need, and is not just how do you avoid ending up in science jail? How do you deal with the real world needs of interacting with others on a team, being effective when you have a problem, presenting research, being an ally, good practices, how to give and get appropriate credit, how to choose your mentors and colleagues for character, where do you find the line between good practice and appropriate self-promotion, and how do you recognize good advice when you get it? In this country, there is less than 0.1% do we spend on programs about responsible conduct of research. Almost 90% is done in this ineffective online multiple choice delivery, which isn't effective. We also know that. And we focus on rules and compliance versus the problems that people really face. So what I advocate is, and what our group advocates is, that this kind of research and education should be relevant to the audience, should be required for everyone. I go a lot of places where somebody says, can you come be the ethical event of the semester? I've heard you're a good speaker. And it's only the grad students who are there, not the faculty. What kind of message does that send about our commitment to the quality of work that we do? It should be required and useful for everyone. Interactive, experiential, using best practices, meaningful, related to the work that people actually do. It's dumb to train people in the minutia of what the federal regulations say about hazardous substances or animals in research if you don't work with those things. It's useful to know, sure, absolutely, there's rules about that. And if you're going to be the most, use the best practices, it's important for you to know there are rules if you start working there, and you should go and educate yourself. It's dumb to ask people to spend their time, the irreplaceable resource, on detail and minutia of compliance regulations for things they do not do. It should be delivered at least in part by respected researchers, and we should be assessing what we do. Mike Mumford at Oklahoma does some of the best research there is on what makes for effective empirical research on ethics education. And he has papers which tell us active, cooperative, iterative, over and over, with strategies for response, positive as well as negative examples, forecasting to help people anticipate the consequences of their choices, emotional self-regulation and reflection, showing people the analysis. And it should be project-based, where we get people talking to each other in their lab environments. And for this, I recommend highly the paper by Plemons and her colleagues that was published in 2020 in PNAS about the lab-based ethical discourse, where you help people talk about not just what we do, how we do it. So we're working with the Howard Hughes Medical Institute on a professional development curriculum tailored to lab environments, where we're based on a problem-based pedagogy, where we work on the analytical decision-making framework that our group uses. We help people develop personal scripts for what do you say when you have a problem. We work through how things go wrong. We talk about what we call the career tragedies, and we work through a whole set of what we call 2-minute challenges, which are the kind of conflicts and dilemmas that people have, so that they have, I think of it as the sort of inoculation theory of education, where you give people little dilemmas, you get them thinking about it, you help them build the neural pathways for responding, so that when they actually encounter a problem, they think, oh yeah, I've seen that before, and you can put your cognitive energy into responding rather than, oh my God, what's happening to me now? So we use an evidence base, we have concepts and skills interwoven, we use the Plemons lab-based discussion, the IREDs, and we do a lot of skills practice and application. So I have published the career tragedies. It's an acronym I developed over time. And the career tragedies are things that we ourselves need to start with, understanding our values, knowing ourselves, knowing when we're tempted, knowing what rationalization feels like. It's only a little bit, nobody will notice. I really need to get this paper. Everybody else is doing it, and I'm entitled. I work so hard. And we're not entitled. Entitlement's a red flag when you feel it. Deception of yourself or others. Incrementalism. Incrementalism gets more people into trouble than practically anything else. And if you've read any social psychology, I would urge you to look in particular at the Ash experiments and the effects of group and authority pressure, and learning about the altruism experiments and how incrementalism happens. Because what happens in incrementalism is that you do something that's on your line or pushing your boundaries a little bit. And then, because we all like to think well of ourselves, we go through a process that's called normalizing deviance, where we say, oh, I'm a good person. I walk my dog, I pick up trash, I give to charity, I volunteer. And if I did that, it must have been okay. And you normalize the deviance, which means you're then able to take the next little step. And then you go through that whole process all over again. And the next little step, and the next little step, and the next little step, until you are in a place you would never have gone in one step through incrementalism. Embarrassment. I talk a lot with people about the two critical things, the skills that you have to work with a group, is to be able to say, I made a mistake. I'm sorry. How can I'd like to have a chance to make it better. And it's also really important to know how to say, I don't know. I don't know. Let me see if I can figure that out. I'll get back to you. And finally, stupid systems. We all work every day in stupid systems. And sometimes you have to go along to get along in a system. Sometimes you have to do really stupid things. And sometimes you have to know where to draw the line and say, no, I don't do that. Let's find another way to solve this problem. Because our systems are full of the folly of rewarding A while hoping for B. And sometimes they ask us to compromise our values. And then you have to have a way of saying, no. So how do things go right? We have to know and articulate our values in non-saccharine ways. One of the things I learned quite early in my career is that I talk to people about what matters here and how do we act here, and is there an ethics code, and what happens when things go wrong. And one of the things that happens when people know you care about those things, and that you care about what's right and what's wrong, and you can articulate why you care about it and why you do what you do. I was sitting at my desk one day in an open area, and I heard somebody around the corner say, oh, don't ask Tina, she won't do that. Go down the hall, ask Larry. He'll sign anything, but don't ask Tina because she'll tell you it's not right. You know what? I would always rather be the person that's not asked, because people know that I don't do that kind of thing. So develop good habits. Listen, ask questions. Use an analytical decision-making framework for solving problems at work. Prepare and use what we call personal scripts, which are words that you prepared and practiced, built the neural pathways in advance for predictable issues that come up at work all the time. Oh, Dawn, hi, good to see you. Hey, could you be on that committee? It's only going to meet, I don't know, like 5 hours a week for the next 2 years. So could you be on it? Thanks a bunch. And then you have to have words prepared and ready to say, you know, I really don't like to take on commitments that I can't honor. Let me check my calendar and get back to you and see if I can do right by that. Oh, you know, I don't know what you've asked. I need to go look at the policy manual and see. I need to think about that. Oh, I really need to run to the restroom. Could I get back to you in about 20 minutes? I don't know. Maybe I could figure that out and get back to you. Those are personal scripts. There are also personal scripts that involve saying, hey, that's great. Thank you for bringing up that hard problem. Hey, we just learned a really important thing because we thought this was going to work and it didn't. What can we learn from this for going forward the next time? Those are words that we have to have prepared and practiced for predictable situations that come up. And we have long lessons about doing personal scripts and practice and a bunch of dilemmas. But as I come to a close, I'd like you to think, please, about the interlocking responsibilities that we all have in our organizations. Our leaders need to think about how do we align the rewards and structures and use evidence and checklists and benchmarking and data sources, and make sure that our mentoring structures are actually sensitive to the needs of those being mentored and to power imbalances, and think about resources and programs that actually prepare students for careers, including supporting mental health and multiple entry points for some problem situations. That's the leadership job. Faculty need to create and sustain environments where we talk about ethical issues in our groups and are knowledgeable and about motivation and constructive feedback, overcome that hazing mentality. Well, I got through this, so you could too. I had to climb uphill barefoot in the snow both ways for 6 miles. You can too if I had to do it. One of the worst examples of that I ever heard was a faculty member with whom I was obliged to have a little visit when I was in the provost's office, because he had told the grad students in his lab, one of whose wife was having a baby, oh, I wasn't present when any of my children are born. She can call when it's done and you can go see it. Until then, we have work to do. You know, that's not okay. And sometimes we have to think about the environment we create and what lessons we're actually teaching. And roles, responsibilities, boundaries, transparency, accountability. What are the values of what we do and why? And students and trainees, one of the lessons is it's your job to build the skills and know where you want to go in your career. And to know and know yourself and guard against the career tragedies. Build a network, have sounding boards, seek help for problems, take advantage of resources, have disputes professionally. Probably the most cited article I've ever written was called How to Blow the Whistle and Still Have a Career Afterwards. And it's mostly about having disputes at work. Prioritize character and choosing your colleagues and mentors, and don't pass on the bad treatment you've received. So we create tools, programs, and resources to develop values-driven and effective leaders to support institutional integrity through intentional professional development, tailored to who you are, where you are, what you do. We provide assessment tools, we do leadership development programs, and we have an online leadership collection with quick tips, interviews, and more. One of our important assessment tools is the Survey of Organizational Research Environment, just developed by Carol Thrush and Brian Martinson. It's not an employee satisfaction. It measures perceptions of the reportable dimensions in an organizational environment. So if we say cultures of excellence and environments matter, we're providing tools to measure them. So initially, we started with 7 scales that looked at integrity. And then we started working to extend it to include civility, psychological safety, bullying. And as we have worked on that process, Carol and Brian, with funding from the Sloan Foundation and our partners in the American Geophysical Union, we're now focusing on hostile work environments, psychological safety, institutional policies, and leadership behaviors. And we are getting ready to do field testing of the extended instrument. We have a non-validated instrument for looking at units, the audit, the academic unit diagnostic tool that looks at vibrancy and challenges in academic units. We have this online leadership collection with material about knowing yourself and building your skills. Oops, I don't know why that's there. And I would leave you with people and structures must work in concert using mission and values-driven data-informed actions to foster cultures of excellence, intentionally, purposefully, thoughtfully. So I would ask each of you, what can you do? What can and should you be doing to inculcate and support cultures of excellence around you? And I'll leave you with a quote from Paul Friedman, one of my favorite writers on research integrity. And he said in 1992, the argument that science must be regulating itself pretty well because it is making progress is far from compelling. Perhaps progress would be twice or 4 times as fast with greater scrupulosity. And in the end of the day, our actions express our priorities. And I thank you for the time. I have some books. There's a new edition of the Survival Guide coming out this summer. And I thank you for your time. And I wish you all the best at this terrific conference.
Thank you so much. I am going to assume that we will hold questions until after Dawn is finished with her presentation. So folks, if you have questions, feel free to put them in the Q&A that is at the bottom of your screen, and we will get back to them when our second presenter is done. Dawn Underwood is the Assistant Vice President for Research Compliance here at OSU. Take it away, Dawn.
Good afternoon, and I am so pleased to follow up with Dr. Gunsalus's presentation. I have the utmost respect for the work that she and her colleagues do at the National Center for Professional and Research Ethics. some of you may know that Oklahoma State used the source survey to assess climate. It's been probably close to 2 years since we did that, and we will likely do that again at some point in the future. And it's a good way for us to start conversations and try to offer resources and things that we can from a central level. But, you know, as CK said, a lot of this it really is about good mentoring and practices in the laboratories. And so from a central level, what I do as the Assistant Vice President for Research Compliance, unfortunately, I see the results of allegations of misconduct coming in. And I see the career tragedies that can happen to people. And I've worked at several institutions and have played that role as the research integrity officer many times. And, you know, sometimes people get there by accident or by the acts of others, but they are responsible for it because they're the lead PI. And sometimes people get there, as CK said, where it's incrementalism, right? They start doing something nobody noticed, and they slide into doing things that are more and more egregious over time, probably. So, I have heard CK talk several times, and every time she talks, it really speaks to me, and it really frames what I'm going to talk to you about in terms of what's going on at the national level in terms of conversation. CK's right in that the regulations really haven't changed, but there are things changing. Things like lots of conversation about research security, right? This phrase that is being bantered around everywhere called undue foreign influence. And so my approach is a little bit different because I want to talk about stuff that's in the news now and try to tie it to some of the good practices I think that CK is talking about and tapping in maybe to some of those resources even to help improve cultures and inclusion, transparency, and holding each other accountable on a daily basis, and building trust and relationships to make research prosper in the most ethical way. So let me share my screen. It'll take me just a second because I clicked on the wrong thing. There we go. Okay, can you see my slides now?
We can.
Okay, thank you, Kate. Okay, so I've titled my presentation Foreign Influence. And at first I had the word undue because the phrase that's really being used a lot is undue foreign influence. But, you know, foreign influence is not always undue or negative. Foreign influence can be positive. It helps spark that creativity. To address global problems, we need global collaborations. And so, so the subtitle is Valuing Diversity, Transparency, and Openness while Protecting Your Research, even your career. And so I wanted to start this, and this was part of the presentation that I really struggled with because it's hard, and CK I think did it so well. It's hard to put this in a slideshow. But I love this phrase, and Gary Vaynerchuk is an entrepreneur, he's an author and a speaker, and he's talking about marketing and how to build relationships with customers. But I love this phrase from him, and it is, could we deploy some soul? And I can tell you that I see faculty members giving of themselves regularly, and that's where the best education is happening. And so, but sometimes from the perspective of a research integrity officer, if we're having to deal with the regulations all the time and having to enforce things and go through investigations and so forth, sometimes we just want to go back and say, let's deploy some soul in this whole thing. Let's open up these conversations and understand where the pitfalls are. What kind of expectations should we be establishing in the laboratories and so forth so that we can avoid problems with research integrity or misconduct. So again, I want to put this in the context of some of the national headlines that that you have probably seen, right? So last January 2020, there was a headline in the New York Times and lots of other places saying US accuses a Harvard scientist of concealing Chinese funding. A scientist is arrested and academics push back. That was a scientist at MIT. A visiting researcher at UCLA is arrested and charged with destroying evidence. A Texas professor and NASA researcher arrested on charges related to China's talents program. So these are, although the regulations and the language hasn't changed that much, there's a lot of enforcement and scary things going on, I think, from the perspective of watching what the Department of Justice is now enforcing in what I think is interesting ways. And one of our challenges with doing a panel discussion is the FBI folks that I've met have been nice people, but I really didn't want the FBI to come on a panel and talk about these topics for us, for those of us who are working with researchers and trying to guide students through their academic careers. But I think it's something that we all need to be aware of. The FBI is active in following up on these cases. The NIH has made a point of following up on concerns about intellectual property and plagiarism, people publishing things that they did not contribute to, or if they contributed, they were not the sole contributors to. So there's a lot of stuff going on politically and enforcement-wise that we haven't seen until about 2 years ago. Kind of started around 2018 where we saw more enforcement kicking up. And I think that the COVID pandemic has really bumped us even further into that. And so let me just go back and say, one thing is that we need to consider also the social context that we're living in today, right? Black lives do matter. Black science matters. Stop Asian hate. Stop bullying or harassment in laboratories. And it does happen. And it doesn't happen in every laboratory, but it happens. And I hear about it because people come and tell me about it in the role as a research integrity officer. And so some of this is valuing each of the people that contribute to the science in the laboratory. And so CK talked to us about some of the principles that were considered, but there's a new set of principles that are also being talked about. And this came from a report from the White House U.S. Office of Science and Technology Policy. It came out in January of 2021. And they set these principles out to consider in terms of protecting the research enterprise from attempts from some foreign governments to collect and benefit from U.S. federally funded research. So they talk about openness and transparency, accountability and honesty, impartiality and objectivity, respect, freedom of inquiry, reciprocity, and merit-based competition. So, and getting kind of down into the weeds a little bit, what does that mean in terms of protecting our research? And openness and transparency is key to a lot of what we're seeing, these headlines, people being arrested. There's an expectation for researchers to disclose potential conflicts of interest and conflicts of commitment. And so that is a push that, although the regulations haven't changed a lot yet, and we do hear some rumors that regulations will be changing, but it will take some time. There is a focus on what are researchers disclosing, how are institutions using those disclosures to manage potential conflicts of interest or conflicts of commitment, accountability and honesty, help acknowledge errors and correct behaviors that can hamper progress. So again, that's going to rely upon some of the communication that CK talked about. Impartiality and objectivity, protect against improper influence and distortion of scientific knowledge. Respect each other. Let each of the contributing members in the laboratory be heard and their contributions respected. Freedom of inquiry, allow individual curiosity to guide scientific discovery. You know, I think that's one of the unique things that I see in the US that sets it apart from some other countries. You know, some of the grant programs in other countries that I've seen are more like contract RFPs, where they say, here's the work we want done. You tell us how much it's going to cost for you to do it and why you have the skills to do it. And here, that self-drive and freedom of inquiry is worth holding on to. So reciprocity ensures that scientists and institutions exchange materials, knowledge, data, access to facilities and natural sites, and training in a way that benefits all collaborating partners. And so despite the fact that disclosures are necessary and sometimes conflict of interest management plans are necessary, you know, the work and the training should benefit all the collaborating partners. And then of course, merit-based competition helps ensure a level playing field where the best ideas and innovations can advance. More specifically, from this report that came from the White House, there were 4 spheres of concern that have really come into the spotlight recently. Peer review violations. So if someone sits on a peer review panel for the National Science Foundation, for example, and then goes and shares a copy of that proposed research with other parties, or if they use the ideas and novel approaches that they've seen in those proposals to advance their own research, that's a violation of trust. And so the National Science Foundation and a lot of the other federal agencies are examining their processes and procedures, their agreements with peer reviewers, and trying to shore that up and minimize the possibility of peer review violations. Because if our ideas are stolen before they even have a chance to be expanded upon or developed, then that can affect not just the researcher and the institution, but the economy of the US. And so, number 2, failure to disclose foreign resources. Foreign resources is interesting because those arrest headlines that we saw were, you know, were payments of salary, but other foreign resources is what if a foreign student comes and works in a laboratory free of charge with no payment? Who's paying that person? Those are some examples that the NIH has seen where a foreign national has come into the laboratories, worked without being paid on any funds from the US, but some of them are apparently being paid by a foreign government so that that foreign government can then get access to the data sets, et cetera. So failure to disclose significant foreign financial conflicts of interest. Financial conflicts like equity in a company, ownership of patents that are filed overseas. Those kinds of things need to be considered so that we can consider the potential effect on the outcome of the research. And then of course, export control laws, which is, you know, very complex, very wide ranging, but important. So just to kind of put out there, these are communications that have been put out from the US federal agencies on the importance of disclosing financial conflicts of interest or conflicts of commitment or other sources of funding. And this is just a list of communications since June of 2019. So a lot of the federal agencies are putting out statements, and some of these say, like the Department of Energy is saying that no one at the Department of Energy who is a member of a foreign talent program can work at Department of Energy in research. And so a lot of the federal agencies are putting rules in place for their own employees, saying that we prohibit people who have commitment conflicts and these employment relationships with foreign governments from participating in the research that we do within our own agency. Some of these communications are about how disclosure requirements they're reminding grantee organizations of the requirements for disclosure, and communicating about how we might review, assess, and manage potential conflicts of interest that are disclosed to us. And so I just wanted to say, you know, that I watch this because I'm a research integrity officer, but this is a national conversation that's happening on many, many fronts. And I do expect, well, there has been several verbal talks in multiple meetings that I've attended where they've talked about making, if someone makes a false statement in a conflict of interest disclosure, whether that should be considered research misconduct or not. And research misconduct currently is limited to data falsification, fabrication, and plagiarism. But there's some conversation about expanding research misconduct procedures to apply to false disclosures. So personally, I don't think that's where it should fall. I don't think it's the best place for it to go, but it's possible that we'll see some movement to see some of this addressed in that way. So again, some of the research disclosures elements that have changed. And here at Oklahoma State University, we did just start using a new system, and we have updated our questionnaire that's done annually by researchers more often if things change. We have added more disclosure opportunities for foreign affiliations, whether they're paid or unpaid. And that's an important one because our federal funding agencies are asking institutions questions about that. How many people have disclosed that? Well, it wasn't even something we had to specifically put in the disclosure forms until recently. We're being asked to put it in there. And so disclosure of outside employment and professional activities. As I said, there is this increased government activity to protect intellectual property and data. And we're seeing that increased government activity from the National Institutes of Health, the Department of Justice, the FBI, also from the U.S. Customs and Immigration Service, which is interesting. They have been conducting regional workshops on making sure people are disclosing what they're carrying with them in and out of the country. And a lot of that relates to export control laws in terms of biological samples being moved across borders. There is what I would call a crackdown on people not declaring what they're carrying on planes with them in their suitcases or in their briefcases. And all of that is part of this increased enforcement. So, but what remains the same in this environment is that having a conflict to disclose is not usually a bad thing. A lot of conflicts of interest that come in are people who have relationships with industry, and those relationships with industry actually help promote their research. Those relationships create opportunities for students to do internships, to gain employment. And so having a conflict of interest to disclose is not by and in of itself a negative thing. And I think that's a hard thing for researchers to understand, that, you know, if I disclose this, what's that going to mean? It's going to be more hurdles. It's going to mean additional delays to my work. And we try not to delay. And it's not a bad thing to have a lot of these conflicts. So we still sometimes have to develop conflict of interest disclosure plans, management plans. We generally get approval by the funding agency of those plans, and then those are annually reviewed to make sure that they're being implemented as intended, etc. So those things are remaining the same despite all this new conversation and enforcement activities that we're seeing. So what I really like about focusing on the relationships in the laboratories is, you know, I can tell people from my office in Scott Hall to, you know, do this or don't do this all day, but I'm not there. I don't understand the pressures that researchers are facing. And so So this is just a message that I would like to put out there to all researchers as they work with others in the laboratories. Each researcher is valued and important to the science. Disclose sources of income and travel support. Disclose your foreign affiliations, if you have any. Ask questions of the research integrity officer. Every institution that receives NIH funding has a person who is designated as the research integrity officer. If you want to talk about a situation, talk about it in the hypothetical. Just say, what if something like this were happening? And that's a great way to explore and learn about the processes for correcting some things that might have just gone a little bit wonky for a while. So I would encourage you to reach out, get to know who your research integrity officer is, have some conversation with them. And I can tell you that having done this for many years at multiple places, that research integrity officers are not out to get anyone. Even when things have gone awry and somebody has done something that seems pretty egregious, these are people, and these are very stressful situations for them to have to be, you know, if we have to start an investigation and so forth. And so we are better off, let's start conversations early and say, what if this were happening? Well, if that were happening, you know, we probably wouldn't have to do this, but we might need to have conversations like this. Let's make corrections before we get to the point of having an allegation come in and it have to be handled through the research misconduct process. And CK mentioned this, things about authorship expectations, giving proper credit to people, avoiding giving credit to people who did not contribute at the author level, at the authorship level. Those are important concepts in terms of setting those expectations, coming to a common understanding, and setting the tone for your research environment. Use Authenticate. And I'm throwing in a product name there, but it's the product that the federal agencies are using. And so if you're not familiar with Authenticate, most documents can be scanned for $100, and it looks for plagiarism. And it will highlight material that it has found in other places and will give you a report. And if you haven't used Authenticate, spend the $100. If you've written a paper, you've written a grant proposal, spend the $100. Or maybe your institution has a license across the board where you can go ahead and not have to pay it from your department. Review your document, make sure that there's not any unintended plagiarism in there. You don't want to be in trouble for somebody missed a citation. A federal agency scanned it through Authenticate and found that missed citation and said you plagiarized, you're now barred from their program. You may never submit a proposal to them again. You may never ask for grant money from them again. That's the kind of zero tolerance enforcement that we're starting to see. And it's very disturbing to me that we have zero tolerance for something that one person's being held accountable for something that somebody else did, but that's the reality of it. And so I have to put that out there as a warning. So, and also it's important to document the research accurately and completely. And so if you have been lax on helping students understand how to document or making sure that they are documenting properly, that can be a crucial aspect when it comes to research integrity. I love CK's phrase on career tragedies and the acronym that was developed. I see career tragedies happen. I see people who end up losing their jobs. I see people who have lost their careers. And so I am in the business of, I would much rather avoid tragedies than see them play out. And so in particular, culture, when you're working with global partners, can be a big part of that. There's not always a common understanding about what is plagiarism and what is the proper way to cite. And so especially when you're working with global partners, that's something to think about. So I want to point out the Federal Office of Research Integrity has many resources available to the public about plagiarism, image beautification versus data falsification, and there can be a fine line. And and disclosures. It's not currently grouped with research misconduct, which is falsification, fabrication, plagiarism, but there is some information in there about that as well. So if you haven't been to the Office of Research Integrity website, I encourage you to check it out. They do have case studies as well, so that you can learn about, you know, people who have had to go through, they've been accused of, and eventually, if they're on that website, they've been found guilty of maybe data falsification or fabrication or plagiarism. But most often, those cases you'll see there will be falsification or fabrication. Those are the easier things to prosecute, and ORI does sometimes work to get those prosecuted. So again, in the end, I just kind of want to come back to this comment of, could we deploy some soul? You know, the fact that we are human beings that care about each other and each other's development and moving the research forward is more important than the things I deal with every day, which is the regulation and, you know, you have to complete the city training or whatever. Building those relationships is crucially important. And that's why I absolutely respect the work that Dr. Gunsalus and her colleagues do, and the work that our researchers are doing in the laboratories. So there's a list of references, and then I just wanted to give you my email address in case anybody wants to follow up. There it is. It's dawn.underwood@okstate.edu. So, sorry I went a little bit long, but we do have 5 minutes for questions.
Well, thank you very much. Excellent. I will ask, I see both of you are in Slack. If you are willing to share your slides, especially yours, Dawn, since you've, well, both of them, because you both had a lot of resources in them. And there is a question in the Slack asking about how to access your resources. So that would be, I think, an efficient way to do it. But if you have an alternate suggestion, we're certainly anxious to hear that as well. There aren't any questions in the Q&A, or I don't see any in chat. However, I have one question, and I think it's mostly directed at Dawn, and that is how, you know, when you show those topics of ongoing conversation and the likelihood that there will be updated and additional regulations, what is the best way for researchers to stay on top of that?
Well, I'll be honest. I think researchers should pay attention to some of the, especially the ORI resources. And I'm just going to show you one resource that I pulled from the Office of Research Integrity website. This is a poster that is available for institutions to print out. And it is about, what is the difference between beautifying an image and falsifying the image, right? So if you make changes to an image to make something show up better, that is generally accepted as long as you explain it, right? You can say, hey, we took these things and we enhanced them so that you could see them better. However, if you took that same sample and you removed all the contaminants from it and you don't explain anything about that, then that would be considered data falsification. And so ORI has these resources. You know, I can push them out from my office, but it's hard for me to sometimes get them out. I printed a bunch of different posters like this and have shared them, and I know they're posted around campus, but you know, should they be in more places and the conversation happening more often? Probably. I don't, there are, just related to an NSF or NIH submission on a grant, 65 different compliance areas to be aware of. Anything from research misconduct to the Scenic Rivers Act. And so I don't expect researchers to try to keep up with the regulation. I think we just want to help them understand where the pitfalls are, what best practices are, and what the environment is that they're working in.
All right.
What do you think, CK?
Yes, I think that a lot of it is awareness. A lot of it is knowing who the people are in your institutions. I think having You know, most of our institutions, if you call up your research integrity officer and say, hey, I'd just like to know who you are and what do you offer that could help us do a better job of what we're doing, people will be there. They will be thrilled to talk to you, absolutely thrilled to talk to you.
Phil Alderman is a researcher here at OSU, and the panel discussion that he's going to moderate is called Cultivating Next Generation Digital Skills for Advancing Convergence Research. Phil?
Thanks, Kay. Appreciate it. So we organized this session because this is an area of great interest, a new emphasis from NSF. But really, it's building on work that has been building over many years. This concept of convergence research is a new term, but the concept's not entirely new. One of the things that was alluded to in some of the earlier presentations was the idea that work is becoming increasingly interdisciplinary. And the low-hanging fruit has been picked, as they say. And the more challenging questions really lie at the interface between different domains. And so when we come to those kinds of challenges, what we are trying to address here is that we've got integration between different domains, different disciplines, and being able to do that well and to do that effectively requires a new set of skills. Some of them are soft skills relating to people and being able to communicate across disciplines, and that has its own merit and can be addressed. What we're mostly focusing on in this session, though, is on some of the digital tools and infrastructure that are needed to help facilitate this cross-disciplinary collaboration to solve some of these very, very challenging problems that lie at the boundaries or sort of overlaps of some of these different disciplines. And if we're going to do that and to leverage those, there are new tools that are being made available. We have to repurpose old tools to solve new problems. But if we want to do that effectively, we need to have the skills in place for us to be able to use those tools effectively. And so what we wanted to address with this session is how do we go about helping researchers, both current researchers, sort of faculty and staff, as well as students, the future of research. How do we help those people to acquire those skills and to put them into practice in this area of convergence research? So that's kind of our theme as we approach it this afternoon. And so what I'm going to do, and this is such a challenging problem. It would be really hard for any one of us. Again, we talked about the idea of interdisciplinarity. So the idea came that for us to have a panel discussion, not just a set of presentations, but a discussion between people and researchers from different backgrounds around these topics. And so what we're going to do is start with the first portion of letting each of those panelists to introduce themselves and just very briefly talk about what their discipline is, where they're coming from, and their experiences in this area of training and relating these kinds of skills. And then we're going to move into sort of question and answer. I have a set of questions that I'll start the discussion with. And then what we'd like to do in the latter portion of the question and answer is to have questions from the audience. So as you listen to these presenters, these panelists discuss, as they interact around some of the early questions, please go ahead, if a question comes to mind, please go ahead and submit that in the Q&A option down at the bottom of your Zoom screen there. And my PhD student Pratishtha will kind of collate those, and then we'll allow some time to be able to ask some of those questions as well. I have my own quite a number of questions that are fairly deep, and we could, I'm sure, spend time on that talking about those issues, but I want to leave a chance for the audience to be able to contribute as well. So that's kind of how we'll run the session. And so I'd like to start by allowing the panelists to introduce themselves, and I'll do that alphabetically. So we'll start with Nora Bello from Kansas State University.
Thank you, Phil. Thanks for having me here today. I'm delighted to participate in this discussion. Just by way of a very brief introduction, Phil asked us to put together a slide, so here it goes. I'm a professor in the Department of Statistics at Kansas State University. My position there includes three components, teaching and research, as well as statistical consulting. In fact, half of my appointment is with the Agricultural Experiment Station. So I do a lot of collaborative work with people in agriculture and the College of Veterinary Medicine. And this basically follows through from my training prior to statistics. I'm originally from Argentina, South America, where I studied veterinary medicine. I'm a veterinarian, and then I came to the United States, to Michigan State University for my graduate work, which started in animal science and ended up encompassing animal science, vet med, and statistics. I was lucky enough to also have a chance to spend some time at University of Wisconsin-Madison for sabbatical leave. So I'm not really your traditional statistician. I'm very much a feet on the ground type person. Phil asked us to also make available our contact information. So here it is, and I'll pass the baton on to the next panelist.
Thank you, Nora. I like that mew joke there. Nice touch. So the next panelist alphabetically is Kai Cole. Kai, are you there?
Oh.
Yes, I am.
Her camera disappeared for a moment.
Oh.
Okay, there we go. All right. Go
Yeah,
ahead.
so I'm sharing my screen. I just have a simple Google site for Kai Cole if you want any more information. I'm an associate professor of research, evaluation, measurement, and statistics here at Oklahoma State. In short, it's educational statistics. My research is primarily in psychometrics and measurement. So I do a lot of item response theory, and I use R quite a bit for that. Nora, really appreciated your mew with your cows. We have cattle. I'm working from home, and we have cattle in our back pasture. So that was nice to see from somebody else, but I've never associated it with the Greek letter mu from our statistics. So I'm going to start using that.
Nice, nice. Let's see, on the list, Franklin, I think I saw him. There he is. Franklin, do you want to introduce yourself? Franklin, I'm not hearing. Is your mic?
Can you hear me now?
There we go. There we go. Yes, please go ahead.
Yes, I'm Franklin Fondjo. I'm the chair of the Department of Technology at Langston. I'm an associate professor of, I would call it engineering technology. My field of teaching and research is pretty much cyber physical space. That means involving sensors and high performance computing. I'm the director of CCRE, which is a small center, high performance computing center at Langston. I'm originally from Cameroon, which is in Central Africa. And I have been involved also in some interdisciplinary research, which I like a lot because that's where I really feel comfortable.
Thank you, Franklin. Anna Moeller.
Hi, everybody, and thanks, Phil, for including me in this panel. I'm excited for the discussion. My name is Anna Moeller, and I currently have actually two roles. One is at Oklahoma State University. I have just recently taken on a position as a technical research consultant, essentially. So I am in the natural resources department and do statistical and R coding consulting with the graduate students and professors in that department. And my other hat that I wear is I'm currently also a PhD candidate at the University of Montana in wildlife biology. So my research is very much focused on using quantitative methods in ecology and developing new models using statistics in a very applied way to approach questions and management issues that we have in the field of wildlife biology.
Great. Thank you, Anna. Bryan Murray.
Yep. Hello, everyone, and thanks for the invitation to join the panel. I'll just go ahead and I have a pretty simple slide, but I guess I'll go ahead and share it. Let's see here. So I'm an assistant professor of forest ecology and geospatial technologies in the Natural Resource Ecology and Management Department at Oklahoma State University, and my appointment is split between teaching and research, with a little more on the teaching side than the research side. And I teach geospatial technologies for natural resources, which is a course for majors, mainly a geospatial course for majors in our program that includes students in wildlife, forestry, rangeland, and fisheries. And so kind of a broad range of natural resource interests. And I also teach an applications of geospatial course that's a little more applied. And then I also teach a spatial and non-spatial database management class that's for graduate students. So I teach both undergraduates and graduate students. My background is I've also taught GIS in an environmental science program before coming to OSU just about 3 years ago. And my research generally focuses on, ecological resilience in forests and other issues in spatial ecology. And so I think about, things that questions related to the complexity of forests and how that influences their resilience. And so that is my introduction. Thank you.
Thanks, Bryan. Appreciate it. And last but not least, certainly, is Steve Welch from Kansas State.
Okay, let me see if I can successfully
Bryan, oh, there we go.
Yep,
yeah.
sorry.
Oh, okay.
That's okay.
If I can successfully share this slide here. I think the way I need to first do this is to share my screen, and I will share that one. And there you see, that's where I grew up. This is my playground, and that's where Dr. Seuss lived. Okay. So anyway, now let me see if I can get this PowerPoint going here. Let's see, slideshow from beginning. There you go. Okay, so I was actually trained at Michigan State as a mathematical ecologist. Today, the term for that is computational biologist, in my case with an emphasis on computation. I work in the agronomy department at Kansas State, and I'm interested in helping to synthesize multiple threads to enable us to predict plant traits from their genotypes. Let's see, hopefully you can hear me a little better now. I tend to operate more on this side of this diagram, but math is math. And so I work with a very large team of people that sort of together bridge this whole sort of multiple scale thing to be able to bring that together. And that's sort of who I am and where I like to play.
Thanks, Steve. So we have quite a diverse panel, number of different perspectives. And so I'm hoping and anticipate a very fruitful discussion here as we think about this topic. So I had a set of questions here that I provided the panel in advance so they could maybe think about some of their answers. And so I wanted to start the discussion off at least. with a couple of those. And so first off, the questions I have here are, what are one or two digital skills, sort of broadly defined, do you foresee being critical for the future of research within your domain? And maybe some of the reasons why you think so. And then also considering where your domain overlaps with other domains, is your answer any different? How does that affect your answer to that question? So basically, what are the skills that we think we need for going into research in the future? And how does that apply within your domain? And then thinking about how, when you're collaborating with others across disciplinary boundaries, you know, how does that affect your priority of some of those skills?
Do you call on people, or how does this work?
Well, Steve, you're unmuted, so we'll let you go first. You can chime in. And
Well,
then,
last time I'm going to ask for guidance
as far
from
as
you.
I'm concerned, you know, if someone has something to say, please do unmute and speak up. And if more people try to speak at once, I will I'll start calling on people. But otherwise, please feel free to speak up. Yeah.
No. Well, so as you might have gathered some from the slide that I showed, you know, you say digital skills. What I would list is just briefly is numerical methods for differential equations models. Now that may not be quite what you meant by digital, but we solve all these things on computers, okay? And so both for differential equation models and then for mixed linear models, because that gets to the statistics side of how we can hook those problems together. Now, if we were to go, if I was to look sort of at the overlap, I've had some recent experiences with other projects that I'm involved with that are really tuning me into the importance of convolutional neural networks and ensemble models where we can bring multiple types of models together. And that might be more what you're aiming at in terms of digital skills, but those are the two kind of answers that at least from, you know, where I operate, that I'd see as important.
Nora, did you have, I thought, did you have something?
Sure, I'd be happy. And just to build upon Steve's comment, and maybe it's embedded in the comment that Steve made, but I think that it's going to be critical for anybody doing science in the future world to have a high level of proficiency in one, or at least one, if not more, low level programming languages. Canned software will not cut it. Not even R will cut it. We'll need to be talking about students having, in addition to their domain expertise, and researchers, in addition to their domain expertise, being computationally savvy in terms of, I don't know, C++, Python, Fortran, and not only on personal computers, but also on a high performance computing cluster. That's going to be the language. That's going to be the starting point to do quantitative science. I personally, in statistics, I think that many of the new challenges are being addressed quite successfully from the standpoint of hierarchical Bayesian models, mostly because they are incredibly flexible and modular in their implementation. So regardless of the complexity of the problem, many times they come down to pieces that you can bite into. So I think that there's a lot to be said for that. Now, as we go down the road of statistics and mathematics and whatnot, I think, and I say this with firsthand experience, it's particularly important that we don't forget about keeping expertise in the domain-specific science. And I realize that this kind of gets away from the digital skills that you're asking about, Phil, because I think that many times we take that expertise on the domain part for granted, and yet that is what keeps us grounded and keeps us working on quantitative methods that are relevant to real problems, as opposed to what I call statistics because I can, not because it matters, not because it solves a problem, but because I can, right? So that domain part, I think it's important to make sure we stay with and we stimulate that in the new researchers. It's not just about the tools. Ultimately, it's about the questions.
Kai, I saw you nodding quite a bit. Yeah, do you want to chime in?
Yeah, I agree a lot with Nora. I think across disciplines, there are kind of software specific for the type of analysis you're doing. So I do IRT and I love R. I love R for a lot of reasons. One, because it's free, but because if you're doing interdisciplinary work, then I feel like those types of softwares that do cross over boundaries in terms of the types of analysis it does is really useful. And for me, I can, there are other software that I use for IRT, and R can call those and interact with other software. But if there is another specific software, Stata, SAS, SPSS, Python was mentioned, learning if you learn one of them really good, it's easier to cross over and learn others as you go. Trying to learn all of them at one time is really, really difficult. And so if you can just focus on one and getting the fundamentals of it, then it's a lot easier, I feel like, as you grow and progress in your research to find those other tools that are necessary. But laying a really strong foundation, to me, may be the most important in the beginning.
So I hear Nora, well, Steve was mentioning sort of numerical methods and numerical programming, how those are implemented. I hear Nora mentioning more generically programming skills, because we don't necessarily have the tools that we need to solve the problems we have. So we need skills to be able to build them. And I hear Kai talking about, yes, that's true. And maybe it's easier though to start with some things that are customized, our packages or software systems that have some of those tools, and then you build out from that. I'm curious, Franklin, you primarily interact with undergraduates, and so I'm curious if your perspective is any different. What do you think about this question?
Yes, I think Steve, Nora, and Kai approach that from the graduate level perspective, and I'm maybe in the underdog in the house, so I can say that on the undergraduate level, we have to, when we are kind of engaging students in undergraduate research, one key component is computing. I would not just say programming, I would say computing, interacting with computer, being able to write those code, right? That means at the undergraduate level, most of the students think like that skill belongs to the computer science student only. But slowly, it has been getting into many other areas. For instance, recently I've been working with my student on some sensors. We will get back to that. But what I see is as challenge for them is not the circuit that we build, it's how to write a program to get what we need to do. And that means the concept, the basic concept of writing that program become the.
Yeah, Franklin is such a self-effacing guy that I view it as part of my duty to brag about him, okay? When Franklin talks about undergraduates and working with undergraduates and so forth, y'all should know, or here's a story, that he once had a team of 3 undergraduates who designed an experiment that NASA subsequently flew in space. Okay, that's what you can do with undergraduates if you go about it the way that Franklin does. I should also say that Franklin is a highly respected figure in the Great Plains Network, which is an association of university computing sorts. And so I'd be interested in what he would have to say relative to Nora's comments about doing things in parallel environments or bigger sorts of things than desktops.
Yes, Steve, when on regarding Nora comment on that, I do believe from the perspective of, first of all, the lower perspective of IoT and the cyber physical space, where we need to have all these small nodes sitting somewhere, collaborating between each other and collecting data, computing to the highest level of high performance computing. It has to be part of all the fields of science if you are doing research, because it doesn't matter whether you are doing research in animal science, where you are using sensors, you're already using some kind of collaborative computing, I would call it collaborative computing somehow at the smaller level. But when it becomes larger and larger, where you also have to start having larger set of data and involving, that's where Steve mentioned again, using all these data science type approaches. And the larger your data will become, you will definitely have to use high performance computing. Then there's no limit to where you can go. Your research is the only one to limit you. I think that's what I.
So a lot of the discussion so far has focused, well, has not necessarily addressed spatial data. And I know that Bryan and Anna, the types of data that you work with, I think tend to be more spatially referenced. I'm curious if your answer to this question is any different with that in mind, or if you have any, or Anna, being in the process of being both teaching others some of these skills, but also still being a student yourself, if that, gives you some different perspectives as you're working through that. Did either of you have any sort of additional comments?
Sure, I can speak to my experience, then I'd like to hear Bryan too. I think this is a little bit more general than spatial data in particular, but one of the biggest challenges that I see is data management. And I think that that's a big skill we haven't touched on yet. I think it's very true what they say that data management ends up being about 90% of a graduate degree, and then the 10% thrown on is what you have time for at the end of your analysis. And that's very, very true when we have something like hundreds of GPS collars out on animals, and they're all coming in different formats, and accessing those data just isn't easy. It also, from my experience, looks like actually storing huge amounts of data. So I've worked with camera data in the past. I did 1 2-year study where I got 1.5 million camera photos from trail cameras. And just the process of going through those photos, but secondarily the process of actually how do you store those photos, how do you keep that information. I think those are skills that current graduate students and a lot of professors in my field don't really have, and we could focus on a lot more.
Bryan, do you have any? Yeah.
I would definitely agree with what Anna said about the importance of data management in graduate school. And another thing to maybe add to that is, sort of understanding how to write a good data management plan as well, both for your own, basically so you can plan out how you'll work with your data, but also to include in grant proposals. I think that's something that can sometimes gets tacked on at the end. So I focus on some of those things in my graduate course. But I sort of thought of this question as well from an undergraduate perspective, and a lot of many of the students who take my class are, planning to be a natural resource professional. And while they might use digital tools, they're not really setting out to make that their profession. So I generally, like in my intro to GIS course, I generally focus on, I guess you could consider this more of a softer skill, but just sort of understanding what is possible with the technology and having a framework for learning new skills in the future, because this may be the only computer-based class that they take. And secondly, trying to build their confidence. A lot of them are really anxious about taking a class they perceive to be like, really hard and advanced. And so, kind of walking them through the process and, showing them how, like what they're able to do and building confidence are kind of the things that I focus on. So.
Yeah, that sense of self-efficacy is an interesting angle. Maybe we can come back to as we continue the conversation. Anna bringing up the point about data management is a key one, and definitely something that resonates with me in interacting with grad students with some of the courses I teach. So all great contributions. I really value what's been said so far. So as we think about, so there's some skills we talked about. We talked about programming. We talked about data management skills. We talked about just basic how to deal with software and sort of sense of self-efficacy with, Franklin was mentioning this and Bryan mentioned it, that particularly at the undergraduate level, they're not necessarily planning to become, top-notch, like cutting-edge research, building your own tools kind of thing, but do you have the basic skills to be able to use software and then learn how to continue learning new ways of using different software and things like that? Some of those kind of skills, sort of do they have enough basic knowledge of how software works that they can then acquire knowledge of other software systems as they need to, as they go through their careers? So as we think about, that range of different skills, I guess one of the things that comes to mind is that there's a whole range of different possible modes of delivering that type of training. And if you think about it, I think about it in terms of a spectrum, going anywhere from sort of dedicated sort of curricular courses on, you're going to learn how to use a spatial, GIS system, or you're going to learn how to use a particular set of R packages to do a particular type of statistical analysis, or, there's more focused sort of coursework in standard curricula to like special topics courses, which might be more project-based and draw on multiple tools or something like that. There's workshops, possibly clubs or extracurricular options for being able to acquire some of these different experiences and skills. So as you reflect on kind of your interactions with students and with other researchers, from your perspective, what are some of the modes of delivery that seem to offer the most promise for the skills that we've been talking about? What modes offer the most promise? And then what are some of the potential pitfalls or sort of perils, if you will, with particular modes of delivery in terms of being effective in allowing people to gain those skills? And it could be both sort of direct consequences or indirect sort of pitfalls or whatever that result from that particular mode of instruction. So what do y'all think about that? I'm thinking, Bryan, you have experience with trying to, more sort of curricular, sort of part of the core curriculum of your department. You're trying to do this. As you've done that and interacted with students in that context, what have you seen that's worked really well? And then what are, maybe if you have some thoughts about, gosh, I really wish this were different about that, or what do you think?
Well, are you thinking about modes of instruction that have worked well?
Yeah, I guess, you know, in reflecting on your experience within sort of, so you think about there's different types of courses and different types of modes of instruction. You know, there's a workshop, for example, that's on some very narrow topic, or there's a sort of special topics course, which again, might be more focused or might have a sort of problem-based learning type of approach. That many times is solving a little bit different problem than a core curricular course, which is, I think, intended to provide a sort of core skill set for students going through a program. And so I guess I'm asking from your perspective, being sort of living in that type of an environment now, do you find yourself sort of saying, well, I mean, this is useful to some degree, but I'm limited in what I can do in that context. I really wish we could do more of this, that, or the other. Is that making sense? Yeah, so provide from some of your reflections on that.
So maybe I'll just start from my, like, you know, kind of intro geospatial course, where I generally try to provide a lot of hands-on exercises right from the beginning, but move towards labs that are more inquiry based and rooted in problem-based learning. And I also have the students develop a project on their own where they get some more, basically allows more freedom to learn maybe some other skills or just apply what they've learned. But secondly, I teach the other class I teach, Applications of Geospatial Technologies, is basically a service learning course where we've partnered with organizations outside the university to complete a GIS project. And so that is much more, you know, hands-on into problem-based learning and with a specific outcome. And so, you know, I think for learning spatial data skills for undergraduates, I think it works pretty well. I've tried to do like more problem-based learning in GIS, but I just find that it, you know, you have to provide the right amount of scaffolding basically, and that takes some time to get there. So what I've arrived at is the follow-up course, which is not yet required for all of our students, is kind of a way to do that for students who want to go a little bit further. So.
Franklin, I know that your sort of environment with teaching students some of these things spans both the core coursework within your department, but also some of those extracurricular options. As you think about, you know, trying to teach programming skills or, you know, some of the software and computer literacy type skills, how have you seen that play out in those different contexts? And what do you think has worked in one versus the other? Or I guess, what does that look, how do they learn differently in those different contexts? Maybe would be another way to ask that.
Yes, as for undergraduate, most of the time for the student from my department here, they have to take intro programming concept and advanced programming concept. Over years, I have realized that they go to those classes for just the grade, the grade and the GPA. You know, that's, as undergraduate, you are chasing two things. You are chasing the grade and you are looking for improving the GPA. Then when they come back, really, there's not, the improvement is not there. They have an idea, but the improvement is not there. Then the only way to solve it, to solve it, at least for the student that I work with, is to infuse some programming in some of the courses that fundamentally do not have programming in there. But whenever I find a possibility to give them a programming assignment, I will do that, because it's only by keeping them programming over time that they will actually master the skills and they will develop that skills that we want. Now with the extracurricular activity, that I have the opportunity now to just have that group of students working with me from different areas, that I can now tell them what and what is the agenda. I can tell them what I expect them to do. And I can sometimes sit down with them and train them on specific skills. You see, personally, I think classes, the challenge of having a special topic class is already to add one more class to the classes that they are taking. That's the problem. And then a workshop, if a workshop happened at the middle of the semester, they are not with you. If it happened during the summer, they are not with you. That means as undergrad faculty, I just see that I see that it's important to be so close to the student, to always be talking with the student and teaching that student over time, whatever computing skill you need the student to have.
So what do you think about sort of depth versus breadth in that context? Because it sounds to me like that you're going very much in depth with the students that you interact with in an extracurricular context. But what do you think about how, I mean, it seems one possible potential pitfall of that is that they know very well a specific pipeline, but may not be able to translate that to other contexts. So what do you think about that? Do you think that's a real concern, or do you think they're also gaining other skills that would allow them to translate what they're learning into a new context?
Yeah, I think the challenge here on the breadth of the whole is to have them first cover the science topic, or maybe the whatever topic it is in that area, before trying to bring them in to cover programming in that area, right? That's why the only avenue that we have is to stay on one specific topic and go in depth. But again, as I think one of the panel, I don't remember who was, said, if you have the concept, if you learn one thing and you really learn it well, it will be easy to translate it when you need to, right? Like right now, if I teach them C or C++ and give them a little bit of Python, I'm sure that in their life, if they want to navigate other environment, they will already understand that, hey, this is something I can do. I just need to start looking at the dictionary and know how to do it, if that can make sense.
Yeah, I'd like to maybe inject a comment here. At least for some of the topics that I listed, a lot of those are in existing courses already. And so a question might be, well, how do we structure students' programs in a way that lets them take advantage of things that exist maybe in other departments and so forth. In departments and schools where the committee sets the rules, that can be easy to do. In other departments where there's more departmental standards, that can be more difficult. And of course, both of those, I'm talking about more graduate things. For undergraduates, Phil, one of your questions on the list was sort of looking at long-term. And so if and when we get to that.
We'll get to that in a minute, but yeah.
That's right, but I've got an absolutely fabulous example to use for that. And
okay, well, I'll make sure when we get to that question, I'll make sure to come back to you then. I really wanted to bring in, I feel like that Nora, Kai, and Anna actually have some unique perspectives to think about from this, because I know that, well, Anna mentioned in some of our conversations previous to this that she really focuses on presenting statistical and R programming languages from the perspective of an ecologist, or from a domain perspective. Kai, you're in a college that is not, you're not in a statistics department per se, but that's definitely a very much a fundamental core of your instruction. Nora, you're in a statistics department, but you are often, trying to instruct students that are in course, a lot of the students in the courses that you're giving at the graduate level are people from other departments that you're trying to train in statistics. So can you, as you reflect on some of your experiences, what do you think about, whether it's workshops? I know, Anna, you've done a lot with workshops, Nora with courses, Kai with, I think, a mixture of both of those. What are your perspectives on that? Kai, you're nodding. You want to go first?
Sure. So yes, I'm not in a statistics course, and students dread having to do statistics in my course. Being in the College of Education, it's not what they're seeking out to do. So with us, they typically kind of view a lot of our courses as service courses, and they take a sequence. And so what we kind of done, not intentionally, but now looking back, I realize it was somewhat effective, was we start them out with SPSS, which is point and click. They don't have to know anything about the programming side of it, the language that's used, the syntax or anything. They can just use the interface and get familiar with that. And then at the end of that course, I teach them how to use the syntax a little bit and teach them what's going on the background of, and how they can have a little bit more control over the analysis that SPSS is doing. And then in the next class is when I introduce them to R. And so I feel like that transition of I'm pointing and clicking, I'm just getting familiar with SPSS. Now I'm using some of the interface of the syntax side of it and actually typing out what I want SPSS to do, kind of prepares them for R, because they have absolutely no computer science background program. If I told them they're going to start writing syntax in R on day one, they would probably drop my class immediately. And so it's a good way to kind of introduce them to it, so that by the time they get to R, it's not like I've never seen this side of working with a statistical software ever. So that's been somewhat effective. They still are a little intimidated by R, but once they, and I just teach one thing in R, and I think that that's one of the important things for, and again, my students, they're not interested in understanding the theory behind the statistics or understanding the software so they can use it in multiple areas. They just want to do what they need to do. When they're in my class, hopefully they'll go beyond that. But I like the classroom setting a little bit better for initially learning something like that, just because they see it every single day, and I make them use it every single day. And we meet in a computer lab, and they're getting that with immediate feedback. And so it's repetition, repetition, repetition. Whereas if it was just a workshop, they use it and then they leave, and it's kind of up to them to have that self-discipline to pull it out, remember what they're doing, and then try to apply it to something else. And so to me, the best way to start teaching and incorporating that for students who are unfamiliar with it is really in the classroom. And again, kind of like I said earlier, once they get that foundation and understanding, then we can use it in other ways, or a workshop for a different type of discipline or something like that.
Yeah, I agree with that, absolutely. In fact, in the modeling course that I teach, students come in there and I say, well, we're going to use Python. And I teach them Python in some early recitations, but I don't teach them Python per se. I teach them exactly the bits that they need to know to deal with the models that they're learning concurrently. Like, okay, you call ODE int to integrate a set of differential equations. Here's what that looks like. You see, like that. And so it's very targeted on exactly what they need to know at any point in time. So I agree with that, absolutely.
And I'm really curious about your perspective on this, because I know that your background is much more in the informal context. So what do you think about some of the things that have been said?
Yeah, I think to kind of build on what Kai was saying and maybe differentiate a little bit, I have ended up, most of my experience is with one-on-one consulting and tutoring, and smallish workshops up to 20 people. But I found a lot of success in really purposefully separating out statistics from R. And actually, I have found that a lot of people in the ecology world, in particular women and minorities who have been loaded with a lot of assumptions of that statistics are really scary, a lot of people have actually found that coding is very intuitive and it makes sense to them and it's easy. But when you combine it with the statistics, it becomes suddenly very overwhelming. And so actually specifically trying to teach those fundamentals of a few functions in R and how to interface with it, I found a lot of success there. And from the ecology side, I think that I also, the way that my brain works, the first time I took an R course, it just did not make any sense. I had absolutely no coding background, and I didn't understand why they were asking me to make an object named A that contains C and Apple and Bob, and none of that really related to anything. So instead, I have started people with something more familiar. So ecologists are very familiar with working with things in Excel sheets. And so a data frame in R is not very different from an Excel sheet, and actually going straight to, here's a couple things you might want to do in Excel. Let's see how we can do them in R. And suddenly things click a lot faster.
That makes a lot of sense. Nora, I'm curious. Yeah, please chime in.
If I can add to that, and I'm glad you brought up, because I think this is a key difference, differentiating the methods, the statistics, how they work, the assumptions that they make from the tools, right? There is a very clear difference that they should not be mixed together. We implement the methods with software for sure, but they are not one and the same thing. And I think that this comes down a lot to responsible use of many of the tools in terms of understanding what's underlying them, as opposed to plug and play type use of some of these tools. Now, I would like to get back to a comment that Phil made just a minute ago that has to do with breadth versus depth on delivering these contents. And it's interesting because I find it interesting. These different formats, I think, offer quite a variety. I personally think of workshops as a way to deliver breadth, as a way of making aware the scientific community of what is it that we can do with new methods, what are the advantages and disadvantages, what are the big picture questions that we can be asking, and how do we go about it from a 10,000 or maybe even 1,000 foot height. Granted, these workshops are usually hands-on, but you get a very limited type of exposure to how they work. I think that though they provide breadth to know what's out there, what's available, what people are thinking in terms of methods and tools. When it comes to depth, I think there is no substitute for a course, either being a curricular course, which hopefully is updated, or a special topics course that runs for the whole semester, because I do believe that there is a process of maturation that the students have to go through to really be able to grasp on these topics. And that cannot happen in a couple-day workshop. This needs a full semester. And let's face it, it's probably taking a course is probably the easiest way to learn anything, because it's usually a very guided path to outputs. So I think you need a bit of both in the training. And I would argue that it's not just for students, but for us researchers alike, in terms of how we stay up to date on what are the tools available, what are the methods available, and how do we go about approaching different questions. Now, once we get to this, there is an issue of critical mass, right? We cannot all have Bayesian statisticians in our department, or we cannot all have a specific, a differential equations person in our departments. Some departments are lucky to do that, to have that, but not everybody does. And this is, I think, where some of the online platforms, limited as they might be and whatnot, they allow us to share some of that critical mass to enable that training on a course basis, so that there is a maturation process that's allowed for the students to happen. But it needs to be hands-on. I completely agree with some of the previous comments. It needs to be hands-on. It needs to be problem motivated. There needs to be a clear end goal that students can latch on, so that this new knowledge is added on to their network, as opposed to some floating thing that they don't know what it's used for. So I think there's a role for both of them. They have a different role to fill. And the key here, one key point, I think, would be the updating part, making sure, particularly for curricular courses, that they are updated relative to where the discipline is at, and that we don't have, courses that haven't been touched in 15 years continue to be delivered, and then those sometimes serve as excuses. Oh, we don't have space in the curriculum for new courses, for special topics courses, because we need to keep teaching those courses that are 15 or 20 years old. So I think there's a conversation to be had there as well.
Great comments there, Nora. I really appreciate that. And actually, I wanted to prod you a little bit, because I'm aware of the fact that both you and Steve have been involved in a special topics course relatively recently. In fact, last academic year, you had 2 semesters of a special problems course. And I know that there were some things about that were really promising, and also some challenges associated with that. I wonder, as you've reflected on that experience, if you have any sort of wisdom to sort of share as we think about, again, there's how do we set things up to help students be effective in those types of special problems courses, especially when we think about some of these skills being very unfamiliar to them, and pulling together skill sets from multiple disciplines that they may or may not have been exposed to in the past. And like you said, special topics courses offer a wonderful opportunity, but also can be quite challenging for both instructors and students. So yes, do you have any words of wisdom for us as we reflect on that, both the potential possibilities and also the challenges there?
So Phil, this is, so Steve is leading a presentation exactly on this topic on Friday afternoon with lessons learned.
But if there were some little things, between you and Steve, if you wanted to sort of throw a few things out and then refer to the time on Friday, but
there are many. There were many. We have done a pretty exhaustive, I think, discussion of what worked and what did not work. And Steve has a pretty nice list of do's and don'ts, both from the student's perspective and from the instructor's perspective. They are not sound bites, believe me. Steve, if you want to comment further at this point.
Okay, so I should say that, and I won't go into all of them on Friday, but there are actually, between the course we were talking about and 2 that are going right now, we've got 3 examples of using special problems courses for this kind of thing. But the one I'll talk about on Friday was the only one that had multiple instructors and was very broad across disciplines and so forth. And the quick message out of that is that if you're going to do this, there needs to be a lot of planning amongst the instructors before you jump into it. okay? And I'll go into some of those details on Friday. Another thing is that if you've got something that ends up running for more than one semester, use the students that you've got in one semester to help with that planning process for the next semester. Don't just assume that it's going to be a continuation or we're just going to do it again or whatever. Work is, it's planning at every time you do it and involving the student. Once you got a cohort of students that's in it, involving them in that planning for what comes after, even if it's a completely different set of students. Okay, so those would be the bullets, and I'll go into it a lot more on Friday afternoon.
All right, well, we'll look forward to getting some more details of that specific example then. So, I guess if I were summarizing kind of on this general theme, I guess I'm hearing that the particular mode that courses obviously offer a more long-term sort of repeated contact type of an environment, which particularly early on can be very important for students to be able to acquire those skills and gain some sense of self-efficacy, as well as confidence for branching out from there. So that courses can really help to lay a foundation and allow them to maybe go a little bit deeper into some of the details. Workshops maybe fit more in terms of updating. So if there's a new approach or a new tool that is coming out, maybe that can kind of fit in and help to augment what has been offered in the coursework. But still, the importance of keeping coursework up to date, and Nora was sort of alluding to this, is being able to make sure that courses that are being taught, that have been taught for 50 years or whatever it is, well, they're just in the curriculum because that's, and no one's touched them since they were put together 20 years ago or whatever. I don't know, whenever someone last went up for tenure, if they haven't been updated since then, maybe there's a need to bring in some of those new techniques and or allow those courses to be sort of superseded by new ones, which help to address some of the skills that are more relevant to the current context. So I'm sort of hearing this idea of things that need more repeated interaction over longer periods of time. Maybe that's more suitable for a course. Whereas if there's something more targeted, Anna mentioned even, this is how, we're doing some of these things in spreadsheets now, but I can show you how to do this in R. And so it's a set of skills that are more narrowly focused and kind of helping to introduce people to something a little bit more specific. Does that sound like a fair summary? Did I misrepresent anyone's perspectives? And I didn't mean to, I don't know if I accurately summarized kind of what you were having to say.
Yeah, I think you did. I think that I didn't necessarily address your question originally, so I will take this opportunity to do so.
Okay.
To throw in another piece, I think that there can be a really nice time and place for very targeted fundamental short courses or workshops, 2-day workshops. So some people don't necessarily need an entire semester long course in order to start using R. Maybe they just need an hour's worth, a day's worth of we're just going to hammer out all of the fundamentals and jumpstart you and set you up for success. And then you can come back in and kind of layer on top of that as well.
Cool. Yeah, that's great. I like the breadth of options that are out there and trying to think about, okay, how do we, I know this has been a part of a conversation that Kay, Bjorn, and at the libraries, we've had conversations about this, of how do we target different options to make sure that we address the full range of needs of students and researchers to help them move forward. So I really appreciate your answers on that topic. I'm going to transition to another question here. I don't see any questions in the Q&A. So of the participants, non-panel participants, please, if you have any questions, chime in, drop those into the Q&A, and we'll transition to those before we run out of time if any come in. In the meantime, I wanted to skip down to the fourth question that I had, which was related to, well, I'll just read it. Suppose your department or institutional administration were to offer to immediately change one or two ways in which these skills, the digital skills that we're talking about, if they offered to change one or two ways in which these skills were addressed within your department or college or institution, what changes would you recommend? And then why would you recommend those changes? So I guess if you reflect on your own experiences within your college, within your department, within your institution more generally, what one or two things do you think could really improve the way in which we solve this problem for students and researchers? But yeah, this challenge of providing opportunities that are appropriate, targeted, and so on and so forth. So what kinds of things would you recommend if you had a magic wand, you could just make it happen? Nora, you were nodding and smiling.
Yes.
Do you have some thoughts on this?
I do have some thoughts on this, Phil. It really builds upon the comment that I've made before, so I'll make it quick. Dealing with identifying courses that are outdated and that need to go, okay? That would be one. The other one would be if there are core courses that have to be taught, have those be assigned to instructors or to faculty that maybe don't have strong research programs, and allow people that are at the cutting edge to actually have the opportunity to teach those skills in a special topics course, or to grow the curricula in ways that are modern and outdated, as opposed to overburdening research active faculty with core courses that can be taught by pretty much anybody else. I think that would be a very strategic decision to make sure that core courses are covered, but that there is a cutting edge piece on the educational side.
I might add to that about fundamental courses in areas. When my wife was a PhD student at Michigan State, she taught a lot of basic biological courses that were at the undergraduate level, and that did two things. Number one, it kind of did what Nora said about sort of freeing up faculty for other things. Number two, those students that are teaching those courses get a lot of experience in teaching. I mean, they have to be mentored and so forth. But, it might be that for undergraduate courses or basic courses, do it with GTAs or whatever might be a way to help with that.
Franklin, I'm curious if from a primarily undergraduate institution, if this might look different to you, like as you think about it, and think about how just how institutions are structured, right? So maybe there are some cutting edge things that you're working on. If, for example, with this interdisciplinary project that we're referencing, could there be changes to the way in which curricula are structured, for example, that would allow those types of opportunities to be brought in a little bit more? I know it's very challenging at the undergraduate level because you have your sequence of courses that students have to take in order to come out the end and check all the boxes. What are your thoughts on that?
Yeah, I think Nora mentioned that earlier when she said already that we have to get rid of outdated courses. And the second thing is to make sure that since they're undergraduate, they have to have the opportunity in different courses to actually apply their computing and coding skills. What do I mean? For instance, they shouldn't teach CS to science student or the science student as if it was CS for computer science. They have to be applied. I think we heard here that is many different approaches of doing that. Then, because it makes more sense to have a programming for a certain topic, I mean, working on something and doing the programming about it, than to just start teaching the concept of programming itself. Then how can we, if I wish to change the curriculum, is to start with adding things like in the Department of Mathematics, like statistics, the class of statistics, having them really incorporate those tools, or using R, of course, still teaching the fundamental, but using R from time to time to infuse that in classes like differential equation, making sure that they don't just teach theory about it, and that they push them to actually program it in the language of choice. Kind of go to different classes like that and kind of make sure they don't get out of that class without any basic, without acquiring any basic computing skill. Then I have tried to do that here, and recently when they allow me to make a slight change, I introduced a course called Technical Computing, because I wanted to go away from the normal intro to programming concept and advanced programming concept, where instead of spending time talking about a concept, the for loop and while loop, we take a problem and we solve the problem, we analyze the problem, we solve it, right? It makes that they will see how programming is being used, and they may now gain more, have more interest to do more with programming. Then that's the type of change I think can happen here. I have invited even the chairs of other departments like biology department and chemistry department to get to do almost the same similar thing in their department. Of course, it doesn't start with the program. It starts with the faculty being able to do that work, right? Because if the faculty is not trained to do it, to infuse that, it doesn't matter. If you can change the curriculum and the faculty will come and push that part out and just do what he or she can do. Then that's pretty much what I think.
Thanks, Franklin. Kai, when I was listening to Franklin, I was thinking also about some of your comments about the sequencing of courses and how you sort of build students towards their capability to branch into some of these more advanced skills. I'm wondering, as you've reflected on that, you said it wasn't intentional necessarily. I'm curious, as you reflect on that, are there other ways to be more intentional about how that's structured and the bridging between the course sequencing and some of those kind of things? Maybe that would be things to suggest to other faculty in your department, or what are your thoughts on that?
Yeah, I think that would be a great idea. I know for us, we don't have, our program is pretty small, and we would love to teach a full course on using R before you get into these other courses, because several of our advanced courses do that. We're teaching our courses and we're at capacity and we can't do that. So I've had a few students who they needed an extra course for their PhD program. They needed 3 more hours in a cognate or a different area. And we've actually sent a few over to our statistics department because they do have an R and SAS course, I think is what it is. There's 2 programs that they teach over there. And it just has kind of become you need 3 more hours. Oh, that would be a great course for you to take to get familiar. And if we were a little more strategic in that, even we could have them take that earlier, not kind of at the end to just fill hours, but to fill it earlier. And so, for us, because we don't have a specific class that's just on programming. I mean, Franklin, I'm kind of jealous that you guys have been able to do that a little bit. But I think that if we were to look at that and utilize, even other departments on our campuses to see what are other people doing in terms of teaching these things and not get really, siloed in my department has to teach exactly what my students need, but to see what other people are doing, I think would be a really good thing for us to do. Whenever you asked this question, I kind of thought, I don't know what I would suggest to our department. And really, I feel like a lot of times they say, what do you need? What do you need? If we ever need a new software, then, you know, they get it on the computers in the computer lab. And so I feel really fortunate that our department really has provided the things that we need for the different, you know, if I want R, they make sure all the computers have R on them, you know, and just things like that. So I feel really fortunate about that.
Bryan, you're unmuted. Did you have a comment on that theme?
I did. Well, I was thinking, I think it was along the lines something maybe Franklin had said about not just teaching programming skills in the programming class, that some of my students in GIS have commented on how they would like to be able to use GIS in some of their other courses. And so I've thought a little bit about how we could do that. There's one course where I've worked with the instructor a little bit to to have a lab where they use GIS, but in a pretty limited capacity. The challenge is that you can't, I mean, it is a core course everyone is supposed to take, but I don't know where you cross the line from, like, can you assume that everyone has taken it? You know, is that fair? But I don't know if there was a way to maybe integrate, you know, not just GIS, but maybe other quantitative skills into other courses. So, and I had another thought that might be a little bit different. I don't know if I should wait to say that, but and thinking sort of more about our graduate program, sometimes I wish there was a way to maybe offer more special topics courses, where maybe it could just be a 1 credit hour course in R, or some specific type of statistics, where you know, somebody could just, you know, decide to teach a 1 hour special topics course, and grad students could take it. I think if that could be integrated, if there's a way to make that work, I think it would allow students to take more of a breadth of those kinds of skills. So.
Yeah, if I could add on to that, I think I actually already answered most of this question in the previous question. But to add on to what Bryan was saying, I could see an opportunity for incentivizing more informal ways of learning. For instance, at University of Montana, I led an R group where we had weekly meetings and we tried to work through R problems together. And throughout the course of the semester, very predictably, attendance just kind of flailed. And there's so many formal requirements and already kind of research requirements on graduate students, much less professors. And undergraduate students, of course, are very into the formal training course. And I don't see a lot of incentive for people to actually seek out those independent or informal learning opportunities. And I think that they could be really beneficial.
Okay, we got a question in the Q&A. I'm going to ask it. Could micro-credentials or digital badges provide a means to document experiences that extend beyond the classroom? That seems like a question that's feeding directly on what you were saying, Anna, about some of those things. What do y'all think about? Are you familiar with that concept, the idea that a digital badge, it's, you know, you go through a certain set of sort of extracurricular opportunities like workshops or training opportunities like that, and then you would then receive, you know, a little certificate or a digital badge. Basically, you know, I know that the OSU Libraries is working on some of those types of programs where they have a series of different training opportunities which allow you to say, okay, well, I've completed, you know, this digital badge. It's that it covers these different basic sort of competencies and things like that. It's not, you know, certainly not anything like a a graduate diploma or anything formal like that, or a minor, but it at least is one way of kind of indicating or showing that, okay, you've done some things in this other context. Do y'all have opinions on that?
Yeah, Phil, I can pick up on that because I have because we have a personal problem. We cannot. That means we don't have enough people to train the student. Then the only option for me was to kind of insert those type of certificates, which are online type training, in the class, so that if they obtain that, I can give them some credit for it. I can give them some point for obtaining that certificate. It gives them the opportunity to go and train themselves on the skill that I need, right? And I have used pretty much a system called lynda.com that is now going to be linkedin.com, where they have access. Of course, you have to pay to be there, but most of the library in the county, they do have access to that resource. Then with that, student can actually get trained, get that certificate, and then bring it back to class so that I can give them some credit for it. That means the credit can be in terms of a certain bonus point. You can choose the way you give them some credit. It won't be like a class type credit, but you can have that in your course in such a way that if they get that completed, you can have this 100 point of bonus point or something like that. That means that has helped also.
Good. Well, I wanted to ask my last sort of question here, because we're getting towards the end. And I know that Kay is going to cut us off on time so that we can keep on track. So I'll ask this last one, and I think we'll start off with Steve, because I think he said specifically he has an example to share. So the question is, changing institutional norms can take time, and furthermore, some modes of delivery are more agile than others. So with this in mind, what roles might you envision for different modes of delivery over a longer term, say 5 to 10 years? There's what we can do now, but then thinking more long term. So what do those different modes of delivery, what roles might they have to meet both the short-term and long-term educational needs for future researchers working in this sort of interdisciplinary convergence research space? So we'll let Steve lead off. I think you said you had an example to share.
Yeah,
right?
so I didn't know if we were going to get to this, so I just posted something to the speaker discussion channel that points people in the direction of what I was going to say. Over this longer time horizon, this ties back to what I said earlier about how can we get more interdisciplinary stuff into programs. And the example I was going to give was specifically at the undergraduate level. Michigan State University, since 1956, has had a entity they call the Honors College. The key aspect to it is that if you are in the Honors College, a huge amount of the sort of general education requirements and so forth are in a sense removed, giving you the opportunity to slot other stuff in, okay? There are specialized honors courses that you can take. In addition, you have a great deal of flexibility to substitute this for that, or you get priority in enrollment because you literally get to enroll first, maximizing your chances of getting what you want. And there are many other sorts of advantages to it. I posted a couple of links in the speaker discussion. I don't know if that'll last beyond our session today. Hopefully it will. I just invite people to go look at that and look at that as a model. The reason that this would be a longer time horizon because it would take institutions a while to institute something like that. So that's why, longer term. I'll shut up there.
Thanks, Steve. We'll have to take a look at the Slack. As you said, that's in Slack, you said? You posted it to the Slack channel?
Yeah, in the speaker discussion channel. Yeah.
And that'll persist. And like I said, I mean, if you guys have thoughts, or if people out there listening have questions or thoughts after this, that is one way for you to be able to continue the conversation. So please take advantage of that.
If I can add another example.
Yes, please.
In the statistics community, one of the models that has created some noise and some very well received noise is a model at Purdue University in the Department of Statistics there that has been promoted by Mark Ward, who's one of the faculty there, and it's called a Statistics Living Learning Community, which is a program. It's called Sophomore Transitions, Bridges into a Statistics Major and Big Data Research Experiences via Learning Communities. I think it's a model that responds to the conversation we're having here. It's a different proposal. I'll post it on the Slack channel as another alternative for people to take a look. I think there's quite a bit of merit to it.
Great, thanks. We'll take advantage of that then. Any other thoughts from the panel?
Well,
okay, Kay.
I was just going to put in my 2 cents. Don't forget your librarians when you are looking at these things. Phil mentioned that he and I had numerous conversations about some of these things, and the data education aspect is something that the library is, believe it or not, working really hard to advance. So
there is an emerging concept called the Cyber Land Grant. And I know at K-State, the library is intimately involved in pushing that concept forward. And so absolutely, libraries are key to a lot of this.
Well, it's been a fascinating discussion. I really appreciate the panelists' perspectives. Really just scratching the surface. I know there's a lot more we could say. I just wanted to take the last couple minutes to kind of review where we've been and kind of where we are at this point, and then hopefully that will be a sort of jumping off point for future conversations. We started out talking about some of the skills that we thought would be of benefit to future research, skills like programming, skills like competency within certain software packages, but also more generally, how to learn software to use it for particular purposes, sort of general skills of computational or computer literacy. We talked a little bit about some of the more particular analytical techniques, such as those available in like R software packages. And Steve also mentioned some of the more numerical analysis type, more specialized techniques that would be suitable to certain domains. We talked about some of the challenges and advantages to some of the different modes of delivery. The fact that courses allow us an opportunity to go deep and also to have, particularly early on in the learning experience and exposure to these ideas, to have repeated sort of bite-sized exposure to some of these concepts, which allow students new to the experience of some of these skills to develop those core competencies and practice them on a regular basis. Perhaps special topics courses allow you to go a little bit more in depth. Workshops being a wonderful example of a way to update and to kind of jumpstart either new techniques or new approaches, things like that. And then we've talked in particular about kind of how that plays out in an institutional context, How do we balance different modes of delivery over time, and had some examples there about how you integrate different elements of these into courses, whether it's curricular courses, revising core curricular courses, assignments, course assignments within departments and things like that. The importance of allowing those who are at the cutting edge to be able to offer those special topics courses, while more sort of standard courses might be able to be taught by other faculty perhaps, or even graduate students or other staff like that, to free up those that are doing the cutting edge research for being able to present other opportunities, educational opportunities to students. And so I feel like that we've covered a lot of ground. We've sort of opened up a conversation that hopefully we'll be able to continue via Slack and other means. I want to thank the panelists again for their willingness to set aside some time to have this conversation. I know that I've gotten a lot out of it. I hope that each of the panelists feel like it was a worthwhile bit of their time this afternoon, and hopefully to all of the other attendees that are participating. I think it was a really, really good opportunity. So thank you. With that, I think I'll turn it back over to you, Kay. I think unless any of the panelists have I think we have 1 minute left, but any last words? Okay, there you go, Kay.
Quick. Yes, thank you all so much. It was indeed a very interesting and productive discussion. I will tell participants that if you did not get your favorite question answered, you still have access to Slack, and I am sure that the participants the panelists would be happy to have you reach out and discuss any of this with them.
So good afternoon, everyone. My name is Kai Wang, and I'm the first year PhD student from the Industrial Engineer and Management Department. Today, I will talk about our research with my advisors, Dr. Bin Yao. This research called the multi-branching temporal convolutional neural network for the sepsis prediction. So in this presentation, I will first introduce the motivations and the challenges in our research, and next I will introduce the methodologies called the multi-branching TCN in this research, and then I will give the main results and the conclusions for this research. So the first part is the introductions. So the sepsis disease is the leading cause of the multimodality and morbidity in the modern ICUs. So there are 3 characteristics for this disease. The first one is the high mortality. According to the CDC website, there are over 270 people die from sepsis annually in the United States. And the second features is the high morbidity. There are over 1.7 million American adults develop sepsis each year. And the third features is the high economic cost. So the cost for the sepsis disease ranks first in the United States, and every year it costs over $27 billion. So another problem is the reliable identification of the prediction of the sepsis is very complicated because of the unclear source of infection and the complex symptoms. Luckily, we can use the electronic health record data to do the data-driven modeling for the sepsis disease. However, there are still some challenges when we use the EHR data to do the modeling and the predictions. The first problem is called the variable length and the multivariables problems. So these 2 plots shows the variable length and multivariables in my research. So basically we can say there are a lot of patients with a different timelines record, and also we have a lot of variables that is the clinical measurement for one patient. So these 2 problems actually resulted in a more complicated data structures in our models. So which is not what we want. The second problem called the missing values. So basically here is one example of the missing values. So the horizontal axis is our time, and each rows represent the different variables we have. So we can see the NA represents the missing value. That is, we don't have any record or observations in this time step. So if we that means we lost the information at that time steps for this patient. So if we have a lot of missing values, we cannot to do the prediction correctly. Unfortunately, there are so the missing value is very common problems in the clinical data set. So here is the one example in my research. So the example here we have the 40 variables, and the y-axis is the missing value rate. So we can see almost all the variables has a missing values, and many of them even have the very high missing value rate, such as the 80% or 90%. So which will also have the negative influence on our performances. The last problem called the imbalanced issues. That is, we only have a small part of data about the sepsis disease. Here, the pie chart also shows these problems. In our research, we only have 5.7% data about the sepsis disease. So if we use such imbalanced data set to train the model, we cannot get, so the model cannot learn much information from the sepsis disease. That will also have a negative influence on the our final performances. So the next part is I will introduce our methodologies. So first, I will talk about the problem formulations. Basically, our research is multivariate time series classification problems. So first, we define the N patients indexed by from 1 to NP. And each case is associated with the historical medical data, XP and YP. XP is our variable, multivariables, and YP is the label. YP equal 1 means this patient has a sepsis at that time step. 0 means they don't have. So the objective is we want to predict the probability of the sepsis for a new patient given a historical sequence of the clinical observations. So here, this video shows the method we use called the temporal convolutional neural network. So basically in this video, we can see we have input layer, hidden layer, and output layer. So each circle represents one time step. So we can see the input layer is our time series data. And for each layers, we can see some layers will skip some time steps to do the predictions, to do the calculations. That is because we want to use more information from the past time steps. And also we can see for each layers, we have the same length. So that guarantees we can do the prediction time by time. And another features for our model is called the residual blocks. It can solve the training problems. Since we have many layers in our models, it will be hard to train with the many layers. So what this architecture do is they will skip some layers in these architectures to guarantee the whole procedures will be successful. So this slide shows our model's architecture. So basically we have two input. The first one is the EHR data, and the second one is the masks layers, masks values. So I will show how we created these masks. So basically, if there are missing values in our EHR data, and then what we do is the corresponding values in the mask matrix will be 1. That means we have the values at this location. However, if there is no missing values in the EHR data, we will put the 0 at that location. That means we don't have the missing values. So based on this method, we can create a same size masks matrix, and then the EHR data and the masks matrix will go through different layers. So for the EHR data, we will go through several residual blocks, and these residual blocks can capture the information from the development of the sepsis. And for the EHR data, these convolutional layers on the right will capture the location information from the masks. So we can see where we have the missing values and where we don't have. And then after that, we combine these two informations together and to input and put them into our branching output. And for this several output, they do the predictions independently, and each output will give us a 1 probability for these patients, whether they have sepsis. So this plot is a simply version of the architectures. It shows how we train the models. Basically, we first to create several balanced data sets. So what we do is we first split the non-sepsis data into the several subset, and then combine this subset with the sepsis data to create a balanced data set. And for each data set, we only choose for the training procedure, for each epoch, we only choose one data set and choose one corresponding output to update. And after that, we repeat these residuals until we update all the output. That solves the imbalanced data problems and also improve our performances, prediction performances. So the result part, we have two evaluation metrics. The first one called the ROC and AUROC. So actually, ROC evaluate the whole performances, overall performances for our models. We can calculate the ROC based on the confusion matrix on the right. So the AUROC is actually the area under this ROC curve. So basically, the large AUROC we have, the better performances we have. So based on this rule, we can say our models MBTCN average get the best performances compared with other benchmarks. So the second evaluation matrix called the PR and PUARC. It is very similar to the AUROC and ROC. So basically, if the AUROC is large, and the better the performances we get. So based on these rules, we can also say our models MBTCN average also get the best performances compared to the other models. So the conclusion parts. So our method developed a novel framework of multi-branching temporal convolutional neural network to investigate the multivariate longitudinal medical data for the robust and reliable prediction of sepsis. And also we designed a multi-branching architecture composed of a co-TCN and multi-branching output to handle the imbalanced data set. So the significances for this research is we propose a new approach to model the complicated structured data for the robust prediction of the sepsis. And also it has broad applications such as the in-hospital mortality prediction or the hospital readmission risk predictions. So we can do other predictions, not only the specific disease predictions. So that's it. Thank you. Thanks.
Thank you, Sekai, for that presentation. So we have enough time for questions.
Mm-hmm.
So if you have any question, please feel free to ask now.
I don't have access to the Q&A because I'm the host, so I'm going to ask, is there anything about your model that is specialized for sepsis such that it couldn't be applied to other conditions?
Oh, okay. So this actually, the method we use is called the deep learning method, deep learning models. So these models can to deal with a very general data set, such as the time series, can deal with the very specific data structures, such as the time series data set. So if the data set has a time series features, we can use this model to deal with these problems. So not only the sepsis problems, but we can also to do the other things. Yeah. So so we can generalize these models to other situations.
Thank you.
Mm-hmm.
Thank you so much, Sekai.
Okay, thank you. Thank you.
That was a wonderful presentation. Okay, so our next speaker is Mr. Nicholas Sejadi. He is going to talk to us about performance metric distribution characteristics of medical school exam items. So, Mr. Sejadi, if you are around, please take it from here and start your presentation.
Yes, as Mr. Mansouri said, my name is Nicholas Sejadi. I am a second-year medical student at OSU's College of Osteopathic Medicine, and I'm happy to be here today to present some of our research. I can go ahead and share my screen. So yes, I am a second year medical student, and this project was part of a series of projects hosted by Dr. Joseph Price, which mainly served as an introduction to computation and data analysis for medical students. And in the field of medicine, this sort of research is becoming even more valuable, especially as computational methods become more robust. And so Dr. Price has afforded us the opportunity to kind of get our feet wet when it comes to computation and data analysis. And so today I'm going to present an analysis that myself and my colleague Lindsay Terry performed under Dr. Price's guidance on medical exam item data sets, and I'll explain a little bit of what that means here. So, as most people in academia are familiar, student competency and mastery of concepts is typically assessed using exams, often in written format, with questions. And evaluating the performance of an individual question, or how a question does, or how students do answering a question on an exam, can be useful information that can inform instructors on whether course objectives are being met, or whether concepts are being conveyed. For example, if a question performs poorly, or if relatively few students answer the question correctly, that may indicate that either the question was too difficult, or perhaps that the material wasn't adequately covered, or that simply the learning objective wasn't met. Conversely, if an item does really well, it could mean that the item was too easy, or that the content was very well received, or that the course objectives are being met. And of course, determining which of those things it is may require further analysis. And so 3 metrics that can often be used to characterize the performance of an item are item difficulty, discrimination index, and point by serial. So briefly, difficulty is essentially just the percentage of students that answer an item correctly. So 100%, or a difficulty of 1 would mean that 100% of students answered that item correctly. Discrimination index is a metric that can be used to tell how discriminatory an item was, or in other words, how well answering that item correctly differentiates high performers from low performers on that exam. So it takes those who were in the top, essentially the top quarter of the distribution on that exam, and then the bottom quarter, and compares how many of those students, the difference between the rates of getting that question right among those 2 groups. And you can use to see, well, was that question good at discriminating top students from, or high performers on the exam from low performers. And point by serial is just the Pearson product moment correlation of the student's response to that question compared relative to their overall response on the exam. So knowing these item performance distributions, how they're distributed, may inform investigations on that would require inferential statistical methods. And some of these statistical methods rely on the assumption of normality. And so if there are curricular decisions that are aiming to be data driven, it's important to know how these metrics are distributed among exams. So previously, there was a investigation by my colleague Lindsay Terry and Dr. Price, and they characterized these 3 metrics for 61 exams here at the College of Osteopathic Medicine. But it's and as far as calculating their values, but how they are distributed was still unknown. So the purpose of this study was just to assess how these item metrics were distributed, and this would inform future investigations on whether to use statistical methods that relied on the assumption of normality, or to use methods that would account for a non-normal distribution. So in order to do this, we took these 61 exams, and I learned how to use R. We loaded these exams up into R, and then we used a few methods that centered mainly around this package, Tidyverse, which is a library of several packages. And each exam set had data for each item, each question on the exam, for difficulty, discrimination index, and point by serial. So in order to assess normality, we did a graphical exploration and then a numerical exploration. For the graphical exploration, we used QQ plots, and this was the package that we used here. And for the numerical exploration, we used the Shapiro-Wilk normality test. And the resulting p-values from the Shapiro-Wilk test were adjusted using the Benjamini-Hochberg procedure to account for the problem of multiple comparisons. So when it came to item difficulty, And this is rather hard to see because of the granularity, but you can see many of the exams had points or items falling outside of this line here and outside of the 95% confidence interval. So a QQ plot takes your data set and calculates a theoretical distribution with the same mean and standard deviation. And that's represented by the line here. And that would tell you if your set was normally distributed, it should fall, all the points should fall within on this line or within the confidence interval. But you can see with item difficulty for these exams, there were several exams that had points falling off of the line and often outside of the 95% confidence interval, which would suggest a non-normal distribution. When it came to discrimination index, there were still quite a few exams that had points falling off the line, but there were still more, or rather I should say fewer exams that had points falling off the line. There were more exams that had points contained within the 95% confidence interval. With point by serial, there were actually very few exams that had points falling outside of the line. So the majority of the exams were actually either on the line generated by the QQ plot or within the 95% confidence interval. When it came to the Shapiro-Wilk exam or test, the Shapiro-Wilk's null hypothesis is that the data set is normally distributed. So if there's any p-values less than 0.05 in this case, that would indicate a non-normal distribution, or at least a statistically significant deviation from a normal distribution. So when it came to item difficulty, you can see that the majority of the exams were less than the p-values were less than 0.05, and which would indicate statistically significant deviations from normality. When it came to discrimination index, there were fewer of these exams that fell below 0.05. So you can see that here. And with point by serial, there was actually very few exams that had statistically significant differences from a normal distribution. So that would indicate that this metric tends to be more normally distributed overall. And here's just a summary of that numerically, that with difficulty, 93% of the exams had statistically significant deviations from normality. Discrimination index was a little bit less at 63%, and then point by serial was relatively few at about 11.5%. So these results suggest that these parameters can vary. They did vary drastically within our sample, and difficulty had the most most exams had item difficulty that was deviated from normality, whereas the point by serial for most of the exams were minimal. Our findings support the use of inferential statistics that account for non-normally distributed data when assessing item difficulty, whereas in the case of point by serial, you may not need to do that, and you could probably safely assume normality in that case. And it's entirely possible that there are trade-offs between these parameters even on the same item. So just depending on what the exam is seeking to measure. So some exams may be mastery-based and some may be norm-based. And it might just be that there are differences in these item distributions depending on the intent of the exam. So to conclude, the study sought to investigate item performance using data from medical students here at the College of Osteopathic Medicine. We looked at item difficulty and discrimination index and point by serial for 61 exams. And we found that item difficulty tended to have the most deviations from normality, whereas point by serial had the least, and discrimination index was of an intermediate value. But these findings facilitate further investigation and inform the choice of inferential statistics that rely on knowing the assumption of normality. And this may be important for when course directors and deans and so forth are deciding to make curricular changes based on data. And so this data and this project would inform those decisions. These are my references, and here's my contact information. And thank you for your time.
All right, thank you so much for that wonderful presentation. We have plenty of time for questions. So everybody, please feel free to ask questions.
I guess two questions. One is this an isolated effort, or is there a larger effort there to do this for a range of courses and so on. And then the second question is there a pathway to actually use this data to, as assessment for improving testing?
Sure. Thank you so much for those questions. To answer your first question, yes, I think largely the intent of this project was as a proof of concept that if we could use the programming and the data to come up with something valuable and interesting, that it could then be applied to other courses and other curriculums. And as far as using the data to actually inform curricular decisions, I think that's maybe out of I may not be equipped to answer that per se, but I do believe that using these metrics is important, just because it might be assumed that data is normally distributed. Because in an intro statistics classes, they often use the exam as like the prime example of the normal distribution, but that may not always be the case. Not only is the exam performance not normally distributed per se, but these item metrics as well. So just knowing whether they're normally distributed or not may be useful for future investigations.
Is there any way to account for, I don't know whether grade inflation is an issue in medical school, or whether, because it looked like you were making some assumptions on difficulty. So how does that harder to quantify factor get taken into account?
Sorry, I think I muted myself. Yes, as far as exam scores go and how they're being normally distributed, we also did an investigation on that, a previous investigation, and found that the exam scores themselves are not normally distributed. At least there are statistically significant deviations from normality there. And the implications of that, again, I think depend on the aims of the course. And I know that in medical school, it's like, you have so many students who are high performers, and so the curves change, I think. And what we found actually was that the exams are skewed heavily to the right. So you have this, these high averages and things like that. And so I think when it comes to making these decisions, using this data may be helpful, but with difficulty, I'm not quite sure how to interpret the deviation from normality. And I'm not sure if one is to assume that it would be normally distributed to begin with, or what the rule of thumb or the guideline is on that. However, if someone wants to find out or to use it, they at least know that these data sets are not normally distributed. So that might help them with further investigation.
All right, thank you so much, Nicholas. That was wonderful. Okay, so our next speaker is Ms. Janshin Chi. She's going to talk to us about physics-constrained deep learning for high-dimensional predictive modeling. So I will pass it on to you, Janshin.
Okay, good afternoon, everybody. Today I'm going to talk about my research, which is called Physics-Constrained Deep Learning for High-Dimensional Predictive Modeling. My name is Jianxin, and I work with Dr. Yao. We're from School of Industrial Engineering and Management. I'm going to introduce, I'm going to introduce the content in the following order. First, I'm going to introduce the project background, purpose, and objective. Second, I'm going to talk about the methodology of the physics-constrained deep learning model for estimate cardiac electrodynamics. In the third part, I'm gonna demonstrate the experimental result that we have the simulation and the comparison study compared with other existing method. The fourth part, I'm gonna conclude this research. First things first, let's talk about the introduction. every year 2.8 Americans died of different reasons. So the top leading cause of death in the United States is listed in this pie chart. We have heart disease, cancer, accidents, chronic lower respiration diseases, and stroke, Alzheimer's disease. As we can see from this pie chart, heart disease become the top one leading cause of death in the United States. The number exceeds the cancer. So to save more patients' life, it is imperative to understand the cardiac disease mechanisms by building a trustworthy model that is able to estimate heart signals accurately. So we have this heart and the body surface. They are 3D complex. They have three-dimensional complex geometry. They are irregular. As we can see from this video, actually the heart surface potential is evolving over time. Let's view this heart as the source of the electricity. So the bioelectricity propagates through body and reaches to the body surface, so that the body surface potential is also 3D distributed and evolving over time. Thanks to the advanced imaging and sensing technique, we can measure this body surface potential mapping by electrocardiogram, which is called ECG. So our objective is to infer the heart surface potential mapping, which let's mathematically denoted as UST, from the body surface potential mapping, which is denoted as YST. So this problem is called inverse ECG problem. So the mathematical representation of this inverse ECG problem looks like this. So the body surface potential mapping YST is related with heart surface potential by a transfer matrix R plus some noise term. There are several challenges to solve this problem. First, we have complex geometry, so that we have high dimensional data, and the transfer matrix R is actually rank deficient, and it has large condition number, which means that small measurement noise, which is inevitable in the clinical practice, can cause large variation in the prediction. In order to deal with these challenges, people have proposed several studies to address this problem. So the existing method for solving the inverse ECG problem, we have Tikhonov regularization method. This is one of the popular methods to solve inverse ECG problem. So mathematical representation, we can mathematically demonstrate the loss over here. So this first term is the data loss. This term is the regularization term. So gamma is mathematical operator for constraining heart surface potential UST. If gamma is identity matrix, we call it zero order Tikhonov regularization. Gamma is some spatial Laplacian operator if it is second order Tikhonov regularization. However, this second order Tikhonov regularization only consider the spatial correlations, but as we see from the video, actually the heart surface is evolving over time. In order to explore in order to infer the heart surface potential accurately, researchers have developed this spatial temporal regularization method. We call it STRE method. So the loss function for this method, it looks like this. We have this data loss term and this spatial regularization term and this temporal regularization term. However, in order to solve this minimize this complicated loss function, it requires either large matrix manipulation, or they have to develop a complicated algorithm to solve this problem. And all of these methods, Tikhonov regularization and the spatial temporal regularization method, they are all based on exploring the data structure, but they ignore the underlying physics law, which is already been well established. So which leads to a inferior predictive performance. So in order to accurately infer the heart surface potential, we need new physics constrained predictive model. So next I want to talk about the methodology of our proposed physics constrained deep learning method. First, I want to talk about the underlying physics principles that can describe the hard surface dynamics, hard surface electrical behavior. Eliev-Pavlov model is widely used in various cardiac research to describe the spatial evolution of cardiac electrodynamics. So the physics model is described in these two equations. U represents the hard surface potential, V represents the recovery current. And the other parameter meaning is over here. So this equation is the boundary condition equation. So it restricts the electricity flow out of the hard surface and into the hard surface. We can reformulate all this into a residual form. It's basically the left-hand side of, we just move the right-hand side into the left-hand side and reorganize this equation to this residual form. And if this hard surface potential obeys the physics law, these three residues should be as close to 0 as possible. And we can, according to this residue, we can formulate our loss function over here. Loss F represents the AP-Pavlov loss, and this one is corresponding to the boundary condition loss. And F and NBC is the collocation points that we sample from the whole spatial temporal domain. And we can formulate our physics laws by summarizing both boundary condition loss and physics laws. Next thing I want to talk about is the data-driven loss, LHB. So this data-driven loss is basically the body-heart potential transformation loss. Then we dynamically design this loss function that includes both data loss and the physics loss, which is formulated like this. This W is a parameter that controls the regularization effect imposed by physics principles. How do we minimize the loss function? So we engage this feed-forward neural network. So the traditional neural network depends on the sufficient data and delicately designed neural network structure to achieve the accurate prediction. However, in our case, because we involve this physics law, then we engage the most fundamental feed-forward neural network, then we can make the accurate prediction. So the neuron value on each layer has the mathematical representation here. The input of this neural network is spatial and the temporal instance. That's here. And we put this spatial points and temporal points into this hidden layer, and the output is the hard surface potential and the recovery current. As I stated before, we encoded these physics principles and data loss and this boundary condition into the loss function. Then what we need to do is trying to minimize this loss function so that we can get so that we can get the hyperparameter in the neural network, which can facilitate the accurate prediction. Third, I want to talk about our experiments result. I want to mention again, our objective is to solve this inverse ECG problem, which means that we have this body surface potential mapping data, and we want to, from this data, we want to accurately infer the hard surface potential mapping. So we set two metrics to evaluate the model performance, RE and CC. RE means the relative error, which measures the estimated the relative error of the hard surface potential with the real hard surface potential, and the CC is correlation coefficient, which measures the similarity of the estimated hard surface potential pattern with the real hard surface potential pattern. So we want RE to be as small as possible, as close to 0 as possible, and we want the CC as large possible and as close to 1 as possible. So here is our result. We compared Tikhonov-based regularization method and the spatial temporal STRE regularization method with our physics constrained deep learning method, PDL method. As we can see from this two chart, we actually our PDL method reaches the smallest RE and the highest CC for all the noise level. Besides, as we can see from this bar chart, the Tikhonov regularization, the blue bar and orange bar, achieves 70% increases as noise level increase, and this STRE increases by 13%, whereas our PDL model only increased by 3.6%, which means that our PDL model actually is robust against the noise. And in this video compares the cardiac electrodynamics estimated by different methods at different noise level. As we can see from this video, our proposed PDL method generates the most similar pattern with the ground truth reference here, whereas STRE and the Tikhonov-based regularization method generates rather different pattern. And in the end, I want to conclude my research. So here in this work, we propose this PDL method, which incorporates data-driven loss and the physics principle-based loss into deep learning framework. The significance is that we propose this new approach to address inverse CCG problem. We developed this effective decision tool to assist the medical scientists for accurate disease diagnosis. It has potential broad applications such as in thermodynamics and tumor growth systems. Any questions?
Thank you, Janshin, for that wonderful presentation.
Thank you for having me.
So we'll now move on to the next speaker, Dr. Bo Zhang. Dr. Zhang will be talking to us about using social media data and understanding public space usage. Over to you, Dr. Zhang.
So good afternoon, everyone. So today I'm going to talk about using social media in understanding public space usage. So like the public's appreciation of outdoor spaces is a historical and long-lasting phenomenon. So we can see that like repetitively in our history. But because of the recording and the documentation were so expensive, so we rarely see a massive reflection of those appreciation. So like social media give us the advantage of understanding how people really love that. So in the Asian, the oil painting, we can see like the grand tourists, when they went to Rome or Italy or Paris or for Florence, they always like to stand in front of a outdoor landscape and have a artist and paint a oil painting for them. So those oil painting was very expensive, which cost like 2 craftsmen's like yearly salary. And we can see the packaging and the transportation of the oil painting was also very expensive. So that's why like we can see very limited number of those, but I think the love is still there. But nowadays, social media give us the advantage of recording the daily activities. So as you can see on my screen, they are my students. They won the homecoming science competition club as a ASA club, American Society of Landscape Architects student club. So the students sitting in front of an outdoor environment, and you can see they are smiling, and you can see they just instantly post an image on their Instagram account. And also you can see many people, they are interacting with many people. So if we compare those two activities, as you can see, they're very similar. So like you can see people like to associate with environments. People want to like communicate with it, either through Instagram or like make it like a oil painting and bring it home, hang in the living room, and talk about their like Italian trip with friends and neighbors, and maybe for a lifetime. So the efficiency, economy, in a huge amount of social media data, it gives us the advantage to understand people's perception, activities, attentions. Hopefully everybody can see this. So attentions of outdoor spaces. So on the top, you can see that's the historical way people have to record it in the paintings. And nowadays, people can just took their cell phone. What they can record it are either scenes or objects, which like with no human beings, like some scenery they really appreciate, or they include the activities with the outdoor elements like the trees, plazas, elements, as well as something reveal people's feelings, the facial expressions. And at the same time, people compose their reflections either in like sentences or in paragraph or in words. So we create a systematic method trying to categorize the current social media data. So we try to categorize those in terms of images. So we categorize images as objects and scenes. Basically, those are where people want to be and with no human figures, as well as human figures. So from the human figure images, we can see activities and the headshots, so which we can see people's facial expressions. For the textual data, we try to group those into 3 different categories. So number 1 is scenes and objects. So most of those are nouns, okay? Most of those are nouns. In the activities, so a lot of those are verbs and experiences or emotions. So a lot of those are adjectives. So we try to, from the current social media data, and relate that to people's usage and experiences of current and public spaces. So we like for most of the time, we mine the data from some website, for example, like Instagram, and we categorize those into sceneries, activities, or experiences for textual data, or sceneries, activities, and facial expressions for imagery data. We try to understand that in monthly patterns, like or like yearly patterns, as well as we try to relate and see, for example, like does the scenery relate to any activities, or does the attention related to their facial expressions? So there are 2 case studies. One is in Bryant Park in New York City. This is like kind of like a famous park in New York City. So what we try to understand is in this park, how people use this park in a yearly base, and does those park programs, which means those like lawns, their reading rooms, their ping pong, memorials, reading rooms, cafe, related to people's activities and their emotions. So here's the results. So This is the way we try to categorize those into different bubbles. And this is, we try to separate those data into 3 different categories. And a lot of those actually, they are not relevant data. We just exclude those. So you can see the monthly popularity of park programs. So in different months, so from January all the way to December, you can see people's attention. And interestingly, in like a downtown park in New York City, you can see people's attention are really attracted to surrounding buildings and the skylines. And the people like to look at the people. And the people use the winter village a lot. And people really pay a lot of attention to plants, grass, and the signage. But at the same time, you can see the monthly popularity of activities in the park. So, which means, for example, like for yogas and for, let me see, so for concert, and so those activities actually are pretty heavily used, like a lot of public programs. And in a public park, eating and dining attract so much attention. So we always, like in the city council meeting, we always say people did not like dining facilities in a city, but actually these are heavily used. They attract a lot of attention. And also this shows the people's perception of the park. We try to categorize those into the perception of seasons, perception of festivals, negative perceptions, reflective perception, sociality and publicity, local pride, and sense of design, discovery, relaxing, and escaping, attachment. So what you can see in a lot of those perceptions very, very stable. And for local park, it adds to the local pride, and it adds to the relaxing and attachment for this area. For the sense of festive, you can see after Thanksgiving and Christmas is pretty high here. And so one thing we have done is we put those bubbles, and we trying to put those into the park actually designed elements. So what you can see is for example, the lawn, which is where concert, which is where film, all those activities actually took place. So we put all those bubbles on the lawn area, and trying to see the efficiency of space usage. So from what we can see here is the lawn area in this in Bryant Park is heavily used. Is against a very high efficiency. So, and also the dining area gains a very high efficiency, but not quite other areas. For example, the landscape areas, people put a lot of effort in maintain them. In the activity areas and the fountain areas, not so much. Let's see. And and we try to use gapping network to understand the relationship of activities and the attentions and the perceptions. So those means the size of nodes, and also the width of these edges, and also the centrality of those nodes. So each one of those, actually, we categorize everything into 99 different categories. Oh, sorry, 112 nodes. So you can see the big ones versus small ones, the centralized ones versus marginalized ones, the strong ties versus not so strong ties. So we can understand for example, where people's happiness or like attachment come from in June versus December. So in June, you can see like the building, like the city infrastructure, the possibility of meditation, eating, and concert and fashion contribute to people's satisfaction in a park. But in December, Christmas tree, winter village, season, locality, all those contribute to attachment more. And also we can test the different park programs. For example, like a winter village, one of the popular program in Bryant Park in December. So you can see in December, it's a pretty centralized. It contributes to locality, attachments, and the meditation and the eat. But in June, it's pretty marginalized. People may still notice that, but it's very further away. It's just can be ignored. So eating in a park. So in both in June and in December, it's pretty centralized. It's related heavily to attachment and the locality. So that's which means this park program is pretty successful in both seasons. Also concert. So what you can see, the concert in June is much more popular in December, and it's much more centralized in December, so on and so forth. So like, which means in this Bryant Park, we try to understand not only the popularity, but also the mechanisms of public space usage. So when like the park administration propose or implement some new program, what's the effect, the activity effect, as well as emotional effect of a certain public program. So let's, the first study, let me see if I have time. I do have some time. So the second study, we try to understand the effect of water in Fort Worth. So a lot of you may be in there. So like it's a water garden in Fort Worth. There are like different water features. So if this is kind of rapid water, active water, this is kind of misty water, or people call it irritated water, and some like reflective water, and no water. This is, so we categorize this park into 9 different categories based on their acoustic, spatial, and water features. And we try to understand those in terms of popularity, in terms of people's facial expression, in terms of distribution of human activities and the perceptions of from hashtags. So those are the 9 different areas. So maybe I don't have time to discuss this in detail, but you can see those different bars, okay? So, and this is people's behavior. When you code those images, it's so funny, like how people show like grand activities and standing in the, so a lot of people actually like to stand and wave in the active palm. Like a lot of people like to see and enjoy the scenery with no human images. People are very excited. They want to wave. They want to have big gesture, and they want to touch the water. So, and also like there are like a lot of like dangerous gestures when people see the water feature. So you can see like in the active water areas, people have a lot of like grand gestures, not necessarily dangerous. A lot of like this terraced water area, people kind of like the dangerous actions. And the interaction of water actually happen a lot in this kind of peaceful pond area. Okay? And also like we do analysis for people's facial expressions, their neutral face, their smiling face, their like depressed face. And so the active palm is more associated with like excitement. For both the active palm as well as the quiet palm, people like to tease there. And so this is the attachment. This is for the all those like data. So to conclude, so the active palm was engaging people, and is evidence from the big gestures and smiling faces. The aerated palm had more seated activities, generated surrealistic perceptions. The quiet palm attract a lot of human water interactions, and people seem to enjoy the feature as a landscape image with no human figure. So this is the method we always use. So the monthly popularity study, park area usage intensity study, park usage network study, and the individual bubble relationship study. So that's basically my presentation today. Thank you very much.
Thank you so much, Dr. Zhang, for that presentation. It is such a cool work that you guys are doing. And someone really loves your visuals, and I do love them too. Thank you very much.